There is a motion to dispense with the calling of the roll of members duly seconded. Hearing no objection, the motion is carried. May I now direct the committee secretary to call the names of our members present via Zoom. Comsec.
Good afternoon, Mr. Chairman, and to our members and resource persons. In today's hearing, we have the following members in attendance. Deputy Speaker Christine Singson Minhan. We also have Deputy Speaker Bernadette Herrera D. We have Deputy Minority Leader Stella Kimbo and Representative Alan Duhali. Your Honors.
Thank you, Comsec. Thank you for your presence and participation in today's committee hearing. We are one with the House leadership to remain committed in the performance of our sworn duty. May I also inform everyone that we are being streamed live on the Facebook page of the House of Representatives. Welcome to our viewers and followers on Facebook. Next item in the agenda is the reading of the minutes of meeting held on September 6, 2021. The members were provided with the draft of the minutes of the meeting sent through their email. Is there any motion to dispense with the reading and approval of the same?
Mr. Chair, I move that we dispense with the reading of the minutes and approve the minutes of the previous committee hearing.
Thank you, DSBH. Is there any second?
I second, Mr. Chair.
Thank you, ma'am. There is a motion to dispense with the reading of the minutes meeting held September 6, 2021 and for its approval. Having duly seconded and no objection, the motion is approved. Good afternoon to the honorable members of the House of Representatives, resource persons, guests, members of the media, and the viewers online. Welcome to the inquiry in aid of legislation pursuant to House Resolution 2075 on the qualifications, research methodologies, partnerships, and composition of Octa Research Philippines, filed by Honorable Deputy Speaker Bernadette Herrera D., Deputy Speaker Christine Singson Mihan, Representative Stella Luz Kimbo, Representative Bong Suntay, and Representative Sharon Garin. This is the second hearing and hopefully the last on this inquiry involving Octa Research Philippines. The first hearing was held last month on September 6, which was attended by representatives of DOH, IATF, ECOP. We thank Dr. Edsel Salvania, Dr. John Wong for their presentations, Dr. Aletea de Guzman of DOH for her input, and UP President Danilo Concepcion for attending. We also thank the fellows of Octa who were able to join us last meeting. Although very last minute, we appreciate their attendance and participation. And they are Dr. Ranjit Rai, Dr. Guido David, and Father Nicanor Austriaco. The Philippine COVID situation has vastly improved from the last time we met with Octa 5 weeks ago. In our first meeting in September, Octa publicly announced that the country was experiencing a surge in infections and was in high risk. This time around, Octa reported that the NCR is now considered at moderate risk and the NCR may transition to low risk in late October. Verily, the pronouncements of Octa can give the Filipino people either hope or fear. With Octa's heightened attention from the media, this is exactly why the Committee on Good Government and Public Accountability must hold these hearings to exact accountability from research groups. May they be composed of fellows employed by public institutions or recipients of public grants from the government. As I said in our last meeting, with great power comes great responsibility. There is a need to be discerning and judicious in using research analysis of experts and scientists. Our methodologies must be effective and accurate. The interpretation must be based on truthful data, not exaggerations to incite panic and fear. And at the end of the day, science must be always objective, never subjective. As chairman of this committee, let me make it clear that the committee is not here to censor or abridge the right to freedom of speech. The House Blue Ribbon Committee is here to demand accountability and truthfulness. From what we gathered from the last meeting, the battle against COVID-19 does not only require a whole of government approach, but a whole of country approach. Private research institutions and government agencies must come together and act in unison in fighting the deadly virus. We must avoid making public commentaries that are subjective in nature. Let the science and numbers speak for themselves. We thank the honorable members and our resource persons from attending this meeting. Maraming salamat po at magandang hapon po sa inyong lahat. Considering that it's been 5 weeks since the last meeting because we had to accommodate one of our resource persons who was sick with the virus, Dr. Ranjit Rai. We gave him enough time to recover so that he can be 100% health for today's hearing. Let me recap what was uncovered initially in the first hearing, considering many have forgotten what was discussed. So here is a summary. Despite its initial labeling as UP Octa, the Octa Research Philippines is not part of the UP system, though some of its members are faculty members of the university. Number two, Octa has not been commissioned or authorized by the government to conduct research and data analysis on COVID-19. There is no formal relationship between Octa and the government. However, Octa said that it is in regular coordination with DOH and provides its data analysis to the department. Number three, DOH used anonymized data from its COVID-19 studies, works with a sub-technical working group composed of private groups and individuals. DOH now has a robust system with contribution from private partners, including a team from the feasibility analysis of syndromic surveillance using spatio-temporal epidemiological modular for early detection of disease, or FASTER. DOH submits its data analysis pertaining to COVID-19 to decision makers that it considers all data can be obtained as it does not rely on single source data. Number four, Octa is self-funded. It is also sourced funds from subscription fees that support Octa's researches and studies. Number five, Octa put the names of their members on all Octa projections and statements, including a statement on their limitations. However, it admitted not having an economist as member and an epidemiologist or infectious disease expert at present. Number six, Octa projections may not be accurate as it used old data. Number seven, Octa presented a matrix that reflected margins of error as low as 5%, whereas our own representative Kimbo showed the margin of error of 79%. Professor David explained the projections of Octa were based on reproduction numbers, but admitted that there were errors in the model that they followed. Lastly, there is a potential conflict of interest as Octa is also undertaking political surveys and advising LGUs while it conducts researches and study for COVID-19 infection predictions. So that's what the committee has gathered so far. May I invite our resource persons if they have comments, preliminary statements on the subject of inquiry to address the committee now. They have provided with a copy of the resolution for the information and study.
Yeah.
May I remind the resource persons who have already taken their oath during the previous hearing that you are under the same oath. For those appealing for the first time, I direct, is there anybody here, resource persons appealing for the first time? Please signify now.
Good afternoon, Mr. Chair. This is
Yes, ma'am.
Yusek Rosette Vergere. I am appearing for the first time now here, sir.
Okay. For those appealing for the first time, besides Yusek Vergere, may I direct the committee secretary to administer the oath to the new attendees, COMSEC.
Please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth before this congressional inquiry, so help you God? Thank you. Mr. Chairman.
Thank you. One of our members has an opening statement and presentation. Representative Stella Luz Kimbo of the 2nd District of Marikina, you are now recognized.
Maraming salamat, Mr. Chair, at magandang hapon po sa lahat. Napakaganda na po ng summary na ginawa ng ating chair, but I would like to also make my own summary. So, good afternoon again. And Mr. Chair, I joined this inquiry because it has always been my firm belief that our pandemic response should be based on the best data available and best data analytics that can be utilized. The public must be provided with the most accurate and relevant data possible. Business must be provided with evidence-based regulations. Malaki ang responsibilidad ng gobyerno pagdating sa datos. Data is life, Mr. Chair. Kung inaccurate ang data, inaccurate ang analysis. Kung problematic ang analysis, problematic din ang projections at sablay din ang policy recommendations. Making inaccurate statements is one of those putting back the toothpaste in the tube situations. When Octa pronounced that we are officially on a surge, the DOH and IATF had to clean up that mess. They had to do the rounds of radio and TV programs to clarify that we are not in a surge, if only to prevent panic and anxiety among the public. Meanwhile, businesses were severely affected. Kaya mahalaga, Mr. Chair, na pag-usapan ang data analytics ng gobyerno para sa pandemic response. Mayroon bang data analytics group ang gobyerno? Meron daw. Yan ang naging maliwanag nung huling hearing. Nasa DOH at IATF. Maganda daw ang composition ng grupo na yan. Merong epidemiologists, merong infectious disease specialists, may economists, meron ding actuary. Maganda nga, pero nasaan sila? Madalang natin sila marinig. Ang madalas na naririnig natin ay isang pribadong grupo na ang pangalan ay Octa. Kung ihahambing ang sitwasyon na ito sa weather forecasting, hindi nanggagaling sa pag-asa ang anunsyo tungkol sa bagyo, kundi galing sa isang pribadong grupo na walang transparency at accountability ang projections. They literally can say anything without pain of penalty if wrong, and even if economically costly. Kung ang maling recommendation ay nagre-resulta sa matinding gutom at sa kawalan ng trabaho, carry lang. Instead of going through the usual peer review process that academics are accustomed to, diretso na sa media para magpa-interview ang pribadong grupo. Kulang ang review process sa isang napakaseryosong bagay. In the last hearing, I showed a simple comparison of Octa's predictions of the number of cases versus the actual number of cases that transpired. Pag pareho ang prediction sa actual number, ang ibig sabihin accurate sila at walang margin of error. But their margins of error are not small. They went as high as 79%. Sila mismo ang nagsabi na merong ang limitations ang kanilang methods. Recently, with the emergence of the Delta variant, Octa made predictions on when the COVID curve would peak anew. They made statements on the following dates. On September 13, 2021, Octa said that the country's COVID curve has not yet peaked and that daily new cases will reach 30,000 within the month. On September 16, 2021, they mentioned that the curve for NCR has not yet peaked, but hoped that it may happen in 1 to 2 weeks. At eto naman, Mr. Chair, ang simpleng assessment ko after the fact. The data show that the COVID curve for both the Philippines and NCR peaked as early as September 11, 2021, when the country registered 26,251 cases and NCR tallied 8,195 cases respectively. So yung sinasabi nilang paparating pa lang ang peak, nangyari na pala. Ibig sabihin, their predictions tend to be more pessimistic than what actually happens. Hence, of course, we know all of these, Mr. Chair, on hindsight. Hence, it is clear by now that Octa made inaccurate public statements with respect to the peak. Now, let's go further back in time to an Octa pronouncement on June 9, 2021. They made a statement about which cities are epicenters, particularly identifying Davao City because it registered the highest number of average new daily cases from June 1 to 7, 2021. Pero hindi naman ito ang tamang sukatan. Kailangan natin tignan ang dami ng cases relative to the population. Kung sinasabing milyon-milyon ang COVID cases sa India, tandaan natin na higit 1 bilyon ang dami ng tao dito. And if one divides Davao's number of daily new cases by its total population, it was only 12th in ranking compared to other LGUs at the time that Octa declared it as epicenter. Again, another inaccurate and irresponsible public pronouncement. Kahapon po, Mr. Chair, nagalit si Mayor Lino Cayetano when Octa stated that on October 9, Taguig recorded the highest number of COVID cases for that day. Again, if we divide the daily cases of the cities by their population, Taguig is only number 6 in the rankings. Sinabi rin ni Mayor Cayetano na hindi man lang minention ng Octa na ang Taguig ay among the cities with the lowest number of active cases and highest number of publicly available testing. Natural, pag mas malawak ang testing, mas maraming cases ang recorded. Taguig City has a sophisticated monitoring system for COVID-19, as they well should, being a business and industry hub. So it is perfectly understandable when Mayor Cayetano called on Octa and the media to say, and I quote, "As we transition and open up, we need these research firms as well as media to report the complete picture, but that has to start with them understanding more what the different numbers related to COVID mean." I'm sure many of us here share this kind of frustration with the mayor. Again, the problem is that when less than accurate predictions are made, apektado lahat. Kaya't kailangan accurate. Kailangan responsable sa pagbibigay ng mga information sa public, lalo na nasa gitna pa tayo ng pandemya. Sa totoo lang, Mr. Chair, madali magsabi kung malapit na tayo mag-peak. Ruler lang ang katapat. Hindi na kailangan ng fancy computations or fancy models. Mr. Chair, here is a simple illustration. If you simply connect the dots, meaning you get the number of cases over time, when the lines get flatter and flatter over time, that means malapit na ang peak. And naturally, pagkatapos mag-peak, pababa na dapat. Pero ang problema, hindi naman accurate ang datos ng DOH. Aminado naman mismo ang DOH dito. Now, given all these challenges, ang pinakamaganda sana ay sundan natin ang US na kung saan ine-encourage ng US CDC ang private universities and private research firms na mag-submit ng kanilang predictions and models complete with assumptions and methodologies at ina-assess nila kung alin sa mga ito ang pinaka-rasyonable na forecast o di kaya pinagsasama-sama nila ang mga prediction. Ang problema sa Pilipinas, isa lang ang private group na willing magsalita at walang sistema ng pagtanggap at pag-vet ng kanilang predictions. Hindi kaya't maganda na lang na magsama ang DOH, IATF, Data Analytics Group at ang mga health experts ng Octa. Kita naman natin ang kanilang interest and willingness to serve the public by sharing their knowledge, time, and talent. And we appreciate them for that. Hindi ba maganda na pangunahin na rin ang pinagsanip na grupo na ito ang pagtitiyak na accurate ang COVID data na kinakalap ng DOH? The best way to improve on the data is to actually use the data. The users of the data are the best critics of any data set. Transparency is also clearly important. Sa ngayon, hindi matik ang pagpapaliwanag ng methodologies ng Octa. Kung hindi pa tayo nag-file ng House Resolution, hindi natin mapag-uusapan ang issue na ito. kung mapapaloob sa gobyerno ang mga experts sa private sector, magkakaroon ng transparency at accountability. And finally, kung ang magandang approach nga ay ang pag-iisang puwersa ng mga eksperto sa public and private sectors, how much resources are needed? Yung 15 million na nasa UP Diliman under Bayanihan 2 is for building a computational research lab at the Institute of Mathematics. Ano po ba ito, Mr. Chair? Anong klaseng lab ito? Ito ba ay pareho sa data analytics para sa COVID response? Sapat na ba ang 15 million? Baka naman mas maganda na dagdagan na lang ang budget ng DOH IATF para sa data analytics para ang existing group nila at ang experts ng Octa ay pwede nang magsanib puwersa. Hindi ba't there is always strength in numbers?
Sige.
They will also be stronger if provided with the necessary support from government. So, Mr. Chair, these are my initial manifestation and questions for today's hearing. I look forward to listening to the answers during the interpellations. Salamat po at magandang hapon.
Thank you, Representative Kimbo, for your very informative opening statement. You have set the tone for this afternoon. And before we proceed with the interpellations, COMSEC, we invited resource persons. Please acknowledge those who are present today.
Thank you, Mr. Chairman. In today's meeting, we have the following resource persons in attendance. From DOH, we have Undersecretary Maria Rosario Vergere, also Director Althea de Guzman from the Epidemiology Bureau. From the NEDA, we have Director Edgardo Aranques and Tomasito Habati Jr. From the UP Octa, we have, from the Octa Research Group, we have Professor Guido David, Assistant Professor Ranjit Rai, Reverend Father Nicanor Astriatico, Dr. Brian Albert Lim, and Professor Tony Lavina. From PCCI, we have Mr. Sergio Luis Ortiz Jr. We also have Dr. Edsel Maurice Salvania, the Director of Institute of Molecular Biology and Biotechnology of UP National Institute of Health. From CDC Philippines, we have in attendance Mr. Bienvenido Oplas and Mr. Mari Caimo. From FASSTR, we have Dr. Maria Regina Justina Estuar. And also, we have Dr. Michael T. from UP College of Medicine. Your honors.
Thank you, COMSEC. We will now proceed with the interpellations.
Mr. Chair.
Yes,
Mr.
yes,
Chair.
sir.
Yes. Good afternoon, sir. And good afternoon to the
How are
members
you?
of the committee.
Are you
I'm
okay?
very good. Thank you po for the consideration given by the committee and the members po. And I would like to request if I could read a very short statement on behalf of Octa, which will, I think, be in solidarity with the statements already made by our very good and honorable Congresswoman Kimbo, and of course, your opening statement, Chair. May we be given the opportunity to read a short statement? And
Okay,
also to
5
present our
minutes.
model. Yes, sir. Thank you. Thank you very much. So good afternoon, Chair Aglipay and the honorable members of the committee. Octa Research would like to thank the honorable committee for the opportunity to share our work, including our volunteers who labor tirelessly pro bono for the past several months, and the methodologies that we use in the process. There is no better platform, in our belief, to discuss these issues than in this honorable committee. We would like to emphasize that Octa Research is a non-stock, non-profit organization. It operates as a non-endowed, self-supporting organization that undertakes research in COVID-19, as well as public opinion research. Our fellows, which provide the research expertise, are affiliated with the major higher education institutions in our country, but are involved in Octa in their individual and voluntary capacity. We have submitted their CVs to the honorable committee for your study. I would like to say I'm proud of this group has converged in the spirit of bayanihan and in the service of our country. Finally, our methodologies, we'd like to assure, are scientific, rigorous, and always open to public scrutiny. We have, in fact, presented this in various scientific fora, both in the University of the Philippines and out. Okay, we recognize that there is no perfect method or model. Thus, our work is a contribution to our collective quest to understand the trends of the COVID-19 pandemic that plagues our country. Okay, and by the way, we are not the only group that undertakes this. This is, there are various groups undertaking COVID-19 research all over the country. Be that as it may, Octa reiterates that it is one with government, it is one with Congress, it is one with the private sector and the entire nation in our collective effort to fight the COVID-19 pandemic. Likewise, we reaffirm our commitment to support and contribute to the national government's efforts to effectively address the challenge of COVID-19. All this we do as part of our public service to the nation. Thank you very much, Chair. And we would also like to inform the committee that we are also ready to present our model as promised. In the last meeting, we will present, and Professor Guido David is ready with the short PowerPoint presentation to inform the body of our model. Thank you very much.
How long is that short PowerPoint presentation? How long?
Maybe at most 10, 15 minutes siguro, at most.
Siguro sa gitna na lang, gitnang part. After the first round of questioning from the members, I will have Dr. Guido share his model. So, konti lang naman magtatanong, mga tatlo lang.
Opo, sir.
So we
No
will now
problem.
proceed. Thank you, thank you, Professor Ranjit. We will now proceed with the interpellations from our members. We will recognize interpellators on a first-to-register basis. Please register with the committee secretary. The interpellators are reminded to limit your questions to issues already identified during the preliminary determination. You have 20 minutes to ask your questions, and the answers, including comments and manifestations made, will be counted to the allotted time. May I appeal to the better sense of our members and guests to observe proper decorum and avoid engaging in debate and argument exchanges. The first in the list of interpellators is Dr. Representative Stella Kimbo.
Salamat. Salamat, Mr. Chair. Nandito po ba ang UP representative? I think
UP?
I see Dr. Sinch Bautista.
Yes,
Are you
yes,
the
yes.
representative,
Yes, I'm
ma'am?
here.
Yes.
Hello po,
Yes.
hello po, ma'am. Magandang hapon
Hi.
po.
Good
Hi.
afternoon.
Yes, my first question is, can you please explain to us what is a computational research lab? Na yun po yung naka-indicate sa Bayanihan 2 na dapat kagastusan po. Yun po yung 15 million na nakalaan sa UP Diliman Institute of Math. So maybe explain to all of us, ano pa talaga ang ibig sabihin nun, ano ang objective ng lab na yan?
I suppose, okay, dahil sa bayanihan siya, ang kanyang trigger is COVID. But that lab is supposed to be projecting and modeling for the pandemic. But specifically, I guess, I guess yung talagang ano niya, I see it broader than the pandemic, except that it is bayanihan, it was COVID that actually triggered it. Suppose it's the establishment of a computational research lab for the Mathematics Institute that happens now to be focusing on COVID.
So, ma'am, I saw the submission of UP that had a listing of all of the research topics. Parang ang napansin ko is kanya-kanya naman siya. Merong research na gawa sa NCPAG, yun yung sa public administration. Merong research na ginawa sa College of Science, merong sa political science, meron din syempre sa Institute of Math. Pero hindi ganun kaliwanag na lahat po yan ay tungo sa isang evidence-based, ibig sabihin na, yun ang naiintindihan ko dun sa computational research lab. Ibig sabihin, gumagamit ng big data, gumagamit talaga ng makabagong mga teknolohiya sa pag-analisa ng big data, and from there, you get policy recommendations. Merong ganong klaseng filosofiya na ini-imply. Although, payak na payak ang pag-describe sa Bayanihan 2, but that's what it implies on its face. So sa ngayon, yun ang tanong ko, bakit naging ganun po ang pag-implementa ng UP na tila basta may COVID dyan sa title ng research mo, pwede ka nang mag-apply. Naging ganun po ang interpretation ko po.
Okay, so siguro konteksto lang po. Yung pong 15 million ibinigay, actually 14,241,000 po yun, of which nakuha ng UP per now, nakuha pa lang is 3.665. So ang bulk po ng perang yon ay sa EO, sa establishment ng computational research labs, so yung mga computers and ganyan. Tapos po, 4.79 million of that was the one that went into the computational research. So I think in terms of, you're saying that hindi siya isang buong agenda na sana big data for everyone and basta may COVID lang, although certain individual research projects here actually are dealing with yung mga analytics. Okay, so admittedly, I guess there are different projects that connect with COVID. They are not all directly related to big data computations or big data analytics. A number of them are. That was a decision that was made by UP Diliman and the College of Science when the money came in November at the end of the month for it to be obligated for the next by December. So that was how it was. I guess what happened here is usually what happens is you have like of course we usually have the call for researchers, but this is not applicable to that. Here you have a group of experts that will determine where basically the priority projects that should be part of that. And I guess this is the group of experts that came together to discuss that. So I think the question on the specific projects, you can ask the experts who were some of them are here. Yeah, but I can see the point that not all of them were coming together or converging around big data analytics. But they're all connected to COVID.
Yes, Mr. Chair, that's also my observation. Pareho po kaming observation ni Ma'am Cinch. May COVID lahat yung title pero hindi masyadong klaro kung paano po lahat ito, ang bawat isa ay nagko-contribute doon sa klarong mandato to create a computational research lab. So ang tanong ko next, Mr. Chair, is paano po napili yung mga nakatanggap po ng research grants? Sino po ang nasa komite na pumili po ng beneficiaries? We asked.
Sorry, Congressman Kimbo, do you have the list of the 19 who got money?
Yes po.
Sir,
I have the list. Nakita ko na po. And ang tanong ko, I asked this in the last hearing, ma'am. Sino po ba yung nandun sa komite na yon? Doon sa submission ng UP, it did not indicate kung sino-sino ang miyembro ng komite na kung saan sila po ang nag-decide. Kung siguro ang research na maa-approve, sino ang researchers na makakatanggap.
So siguro ang sagot ko po dyan, para yung the analogy of that is our Energy Research Fund. We were given 100 million for an Energy Research Fund for which the SARO came out in November. Hindi siya, most of our projects in UP, we have a committee that actually vets for 2 months, di ba? I mean, you're familiar with this, 1 or 2 months, and then they vet, and then some are rejected, some are accepted. In the case of Energy Research Fund, kasi ito naging precedent nitong computational research lab. The case of the Energy Research Fund, we brought together the experts. It was the system that brought together the experts from economics, from geology, from engineering. Kasi these are the ones who are already working on energy, been working with the energy, with government on energy and energy policy. So it was this expert group that had to come together. Do we or do we not, diba, do this? And the expert group decided that there are 4 important areas that we will have to get into. And those 4 important areas, including alternative sources of energy, is where we will put this money. But because
Mr. Chair,
Yeah.
pasensya na po.
Yeah.
Simple lang naman yung tanong ko. Wag na po yung energy experience ng UP.
So
Yun na lang po.
Oh,
Simple lang po. Sino po yung nandun sa committee? Sino po ang mga miyembro ng committee?
So itong
Opo.
itong experts po na ito, yung mga si Guido. mga galing sa Institute of Math, as well as those who are already working on COVID, ba? Or at least have been doing some work on COVID. What, kasi there are some people in UP who are also
Mr.
doing,
Chair, so nabanggit
analytics, diba?
po, so yung mga pangalan po, no? So si Guido David is a member of that committee, as you had
Yeah,
mentioned.
it's not, I guess it's not a committee as it is a collective of people who have been doing work on this.
Yes,
So they
that's fine. We just
Yeah.
need to know the composition, ma'am.
Okay.
It's a very
So,
simple
so
question.
I
Who
guess,
were those involved
Okay.
in the choosing of recipients of the grant? Very simple po. Let's not add color
so,
to this.
so I'm sorry that that's a UP Diliman decision kasi, di ba? So
That's fine. I just need
it's
the
a UP
names po.
Diliman decision. So maybe I would ask exactly who are there. But basically it's the College of Science and the Institute of Math. So I suppose the director of the Institute of Math was part of that group because he is also one of the researchers. But sorry, Your Honor, I don't know the
you mentioned,
specifics. Yeah.
yes, you mentioned Guido David. Was Mr. Rai also part of that?
I suppose, yes. I suppose of the collective. It's not a
So
committee,
you know for a
it's
fact.
collective.
You know for a fact.
Yeah, I guess so. I guess, Raj.
Ma'am Cynthia,
Yes.
I'm not part of
No,
that committee.
sorry, you cannot just butt in, Dr.
Sorry,
Rai.
Okay.
sorry,
So
sir.
maybe may I ask, or Your Honor, may I ask Dr. Guido David, who was on top of this project? I think the questions might have to be better answered at that level.
It depends to Ma'am Stella Kimbo if
Yes,
you want to.
Mr.
to,
Chair.
Yeah.
Nanggaling din po ako sa UP. Ang alam ko, hindi po juridical entities ang bawat institute at ang bawat kolehiyo. Hindi sila pwedeng mag-issue ng check, etc. So in this case, pinaubayan niyo po ang desisyon na yan, Dr.
So I guess
Pinaubayan niyo po sa Institute of Math.
it's the Institute of Math that's implementing it.
So they had full authority.
They're the ones who actually
Okay.
implement. So that goes, but then full authority means that all the checks are not coming from, it all goes to a process, diba? From
Okay, but
them, it goes to their dean, it goes to and it is the chancellor of Diliman that approved the projects. It did
Okay,
not even
so
get to
Mr.
our
Chair,
level. Yeah.
Okay, so Mr. Chair, dinelegate bale ng UP Diliman sa Institute of Math ang pagpili ng grant recipients. Tama po?
Maybe we ask, Your Honor, maybe we should ask the head of the project, Guido David. If it's okay with
Yes,
you.
Mr. Chair, can we proceed po to Dr. David and ask the same question?
Yes,
Kung
Dr.
paano
Guido,
po ang naging proseso?
you
Opo.
please answer, Dr. Guido.
Yes. Good afternoon, everyone. Good afternoon, Chair. And then regarding the question, ni Madam, the committee, it was a committee loosely. It is composed of the Dean of the College of Science, the Director of the Institute of Mathematics, and myself as project leader. So that's the answer. And it was approved by the Chancellor of UP Diliman.
And Mr. Chair, can you tell us kung ano yung naging philosophy ninyo dito sa Computational Research Lab? Anong naging vision ninyo para ma-appreciate po namin yung pagpili po ng recipients ng grants?
O sige, nakalimutan ko eh. Sunod siya. Sunod siya.
Mr. Chair, can you kindly recognize Professor David?
Yes, I did already. I did recognize him. I did already.
Yes, there was a tight deadline for the project because our understanding was that it was going to be liquidated. It had to be liquidated before the deadline, and due to time constraints, the selection process.
Sorry ka mo, nakalimutan ko eh.
Yeah, we advertised the call for the research, but due to time constraints, selection was made among those who submitted proposals, and the spirit of the project was that when COVID hit us, not a lot of research has been done on COVID, and COVID was something new. There were not really any experts on COVID in the country, so this was a way of not just scaling up the resources of the institute, but also to promote researchers and professors, scientists, in engaging in studies related to, well, primarily related to the pandemic, to the COVID, but also in support of research that will, in the end, promote multidisciplinary research in these areas.
So Mr. Chair, para lang simple, no? Lumalayo tayo ng lumalayo. Ang simpleng tanong ko is, ano pa itong computational research lab na to? At can you just maybe, would you agree with our initial assessment na ang nangyari in the end was that all of these researches that you're doing are really very important ones. We're not questioning the usefulness of those researches, except that hindi siya masyadong tugma doon sa objective na gumawa tayo ng isang computational research lab na kung saan meron kang logistics, meron kang infrastructure, meron kang software, meron kang know-how on how big data can be used for purposes of designing policy. Is that a fair statement po, Mr. Chair?
Madam Mr. Chair.
Dr. David?
I'm sorry, sorry,
Mr. Chair.
Mr. Chair. Can the question be repeated? My internet was a bit
Ma'am Stella, repeat
Yes,
the question.
okay. Para naman ako nasa class, pinaparepeat sa akin ng teacher. Dahil
Sorry,
hindi
ma'am.
nakinig yung teacher. Parang simple lang po ang tanong ko, Mr. Chair. Ano ba talaga itong computational research lab? Parang lumalayo tayo doon sa usapan na yon. So ang gusto ko na lang alamin is, tama ba yung initial assessment po namin or natin na hindi na, although lahat ng researches naman na nakalista ay very useful and highly relevant, and we will not contest that, no? Ang naging problema lang is parang hindi siya masyadong swak doon sa objective na mag-create po tayo ng isang computational research lab na ako sa aking pagtingin is, ang ibig sabihin niyan, ito ay suporta para sa hardware, para sa software, para sa training, para sa pagsulat ng mga researches na kung saan mapapakita na pwedeng gamitin ang big data para sa purposes ng paggawa ng COVID-related policies. At sinasabi nyo nga kasi nga kinulang kayo sa oras. So ang nangyari is parang lahat na lang pong nag-submit ng kanilang proposals at basta naman sila ay related to COVID, yan na lang po ang nakatanggap ng or na-approve sila for support under this particular provision of Bayanihan 2.
Yes, that's correct. That's correct, Madam. So the initiative, there were two parts of the initiative. As you mentioned, big data analytics is one thing, one integral component of that, and there's a support structure for that. But in addition to that, there were, as we mentioned, research proposals. These are small-scale research proposals of, you would admit, since you were in UP before, these are, relatively small amounts for a research grant for independent research to augment our knowledge of COVID and of big data analytics in general.
So Mr. Chair, again, uulitin ko hindi ko sinasabing wag natin supportan yung research na yan because these are all important. Ang sa akin lang is, at this point in time kasi, kulang na kulang talaga ang data analytics ng ating gobyerno. So I'm really hoping na kung napatupad natin yung provision na to sa Bayanihan 2 in a timely manner, sana siguro at this point in time, kahit paano, baka natulungan natin ang capacity building ng DOH pagdating sa paggamit ng datos. So at this point po, I'll move on to DOH. I know that I have limited time. I'll move on po to DOH and nandito po kasi si Yusek Vergeire. Let's take advantage po of her presence. Ma'am Yusek, Mr. Chair, tanong ko lang po, no, so clear naman na meron tayong data analytics group. Kayo naman po ang spokesperson din ng DOH. Nagtataka lang po ako kung bakit tila naunahan kayo lagi. Lagi kayong nauunahan consistently ng Octa pagdating sa kanilang pronouncements or predictions pagdating sa COVID. Ano po ba can you explain to us kung ano ang naging dynamics ninyo with the Octa group, at least from your perspective? Ibig sabihin, sure naman ako that you know of their existence. Was there ever a time na hinikayat niyo ba sila na sumama sa inyo? Nagkaroon ba ng areas of cooperation? Kayo po ba ay nag-a-agree sa lahat ng statements? Were there situations na hindi kayo nag-a-agree? And in those situations, ano ang inyong naging filosofiya?
Yes, Mr. Chair, if I may respond.
Yes, please do. Please, you're recognized.
Thank you, Mr. Chair, and good afternoon po, Congresswoman Kimbo. First, as early as 2020, when we were trying to organize the data analytics team for the Department of Health and the IATF, we already have invited the UP Resilience Institute that started off this first outings, UP Resilience Institute po, and they were very hesitant because the Department of Science and Technology, which initially created the FASTER, the system and the tools with Ateneo, they were the ones inviting all of the experts to join in so that all of these projections, all of these data systems that will be produced or developed will be housed in one under the DOST so that national government can benefit from that. But during that time, according to our team, that the UP Resilience Institute was hesitant and this did not push through. So what we did was to create the data analytics team for the IATF, which is comprised of concerned national government agencies with our experts, and that includes the FASTER team. We have AIM, we have Epimetrics, the team of Dr. John Wong. We have our technical advisory group of experts where Dr. Salvania is part of. And then we have other experts as well. So this was the data analytics team wherein we are trying to look at the different projections, looking at data every week so that we can see the trends. Now, as to how Octa publishes their and talks to media about their projections, it's not that we are not decisive, Mr. Chair and Congresswoman Kimbo. We were just being very cautious because every Monday naman po, naglalabas po kami ng datos. But as to this kind of projections kasi, we were noticing and we have observed that there had been a lot of factors and we were challenged by these factors in obtaining data from the local governments. So that, for example, we publish the RT, that's every day, through our situational reports. But having to explain this to the public in such a way that we would say that, hey, the RT is increasing, we need to prepare because there's going to be a surge. We cannot be like that. We always say we are accountable to the public. We need to give them the right interpretation. Need to direct them on what they should do. And we cannot add on to that fear and anxiety of people. Now, when it comes to Octa's predictions or forecasts, there has been differences. And we've tried reaching out to them actually. In the early part, I think that was middle of 2020, we started reaching out because we saw that there has been this confusion among the public already. So we needed to manage that so that public will be directed properly. The first time they met us and we tried to explain and we tried to ask for their assumptions, what would be the details into their projections and systems and what should we know and how can we align. And they were very cooperative actually. The second time around, we called on them, they did not attend. I'm sorry to say this, but we called for that meeting and nobody attended. We waited, our experts were there and they did not attend. So wala pong nangyari and we continued on. And then the next time that we called for them, nag-attend naman po sila uli. This is with Dr. Ranjit, Dr. Benjico and the others. And we explained no, kung ano-ano. So again, the request for their details on how they do their assumptions para ma-align po namin yung ginagawa namin. We even created this messenger group as they have requested so that any questions will be coursed through that. Time and, every time meron hong mga times na Father Nick, no, would always message me, pwede ba akong pahingi ng ganitong data? Ito kasi yung ginagawa. Ay, pinibigyan naman ho namin. Tapos, binabalik naman sa akin ni Father Nick yung ginagawa niya mga resulta. So, may mga gano'n naman po kaming pag-uusap. Kaya lang, official and formal na relasyon para makapagtrabaho po and to align. Wala po kaming gano'n. The main difference with their model and our model would that be their model uses the SIR, susceptible, infectious, recovered. Kami po may kasamang E, exposed. SEIR ang ginagamit ng faster team po namin. Ang amin pong mga assumptions, ini-include po namin, and we always report this to the public pag naglabas po kami ng projections na dapat we take this i-interpret with caution kasi yung assumptions natin, nagpapalit-palit araw-araw, katulad po ng vaccination coverage, ng ating PDITR response, yung compliance sa minimum public health standards. We always give that kind of information also to the public when we go out and say na, ito yung mga kaso natin ngayon, pero kailangan cautious tayo sa interpretation kasi ngayon nakikita namin, nababawasan ang testing outputs natin at tinitignan namin kung dahil ba ito sa paggamit ng antigen and so on and so forth. So yun po ang hindi natin nakikita namin ng DOH, nakikita in terms of what Octa presents to the public na alam nyo, kumukuha kayo ng datos sa amin, you should know also the factors which affects our data. Kaya kami very cautious maglabas kasi tinitignan muna namin, we validate everything. We cannot just say to the public na today there's a surge and then tomorrow nung bumaba na, ay wala na palang surge. Hindi po kami pwedeng ganon. So we need to be very exact when we go out and tell the public, eto na tayo ngayon. Talagang nagde-decrease na yung kaso. This is what's going to happen. These are our projections. And by that time, pwedeng hindi natin yan marating, which we have done. Last month, sinabi namin by end of August, ganitong numbers. And ang NCR po kasi nag-intensify sila ng kanilang response, hindi natin inabot yung projection. So yun yung gusto namin pinapaliwanag po sa public na medyo may confidence naman po kami na tama na po yung direksyon na ginagawa natin. There are still a lot of differences with their model and our models. Siguro po mamaya the faster team can better explain. But pag tinignan po kasi natin, they use the RO to predict these numbers. And we all know, and our experts had been saying this, maraming factors po nakakaapekto sa RO. Kaya hindi lang yun po ang tinitignan namin for us to project what numbers we will have by the end of the month or maybe next month. So yun po, Congresswoman Kimbo and Chairman, Mr. Chair, I hope I have explained it properly as had been questioned.
Mr. Chair, maganda po yung paliwanag ni Yusek. But I'd like to ask, last question na lang po kay Dr. Elvira De Lara. Who I believe is the head of the FASTER team. Tama po ba?
Mathematics group po. Dr. Rina Estuar is the project leader po.
Pero sino po yung chief modeler doon po sa FASTER?
Ako po.
Kayo po. Okay. So ang understanding ko kasi po, ang problema sa R0 is hindi niya kayang, you cannot simulate on policy variables using the R0. That's number one. And number two, hindi mo pwedeng i-compute yan araw-araw. So, tama po ba ang understanding ko? Can you please give us a lowdown on, wala kasi kayo dito nung huling hearing, nung pinapaliwanag po nila Professor Guido ang kanilang methodologies, siguro itatanong ko naman kayo, ano yung ginagawa ninyo, ano yung main difference dun sa ginagawa ninyo? And pwede nyo na rin sabihin kung ano sa palagay ninyo, anyway, academic naman ang treatment, ano sa tingin ninyo ang pinakamalaking limitation doon sa ginagamit na methodology ng Octa Group?
Okay po. Congressman, Chair, Mr. Chair, will you allow me po to present the
Yes,
comparison?
Please continue.
Okay po. So I'll share my screen po. Sandali lang po. So I will explain for I'll make a comparison po of the model based on science po. I will start with maybe the Octa model po based on what I know, based on their presentation last April 2021. Maybe Dr. Guido can expound on this or make changes if necessary. So this is the Octa model for a reproduction number. They're using an SIR model with 3 equations. They use an SIR model with 3 equations and 3 variables. It's a standard model found in textbooks for diseases that can be captured by an SIR model. Now, my analysis of their assumptions based on the model is as follows. Number one, the model assumes that there's constant population throughout. There are no births or deaths. Second, the exposed and infected individuals become infectious immediately. And third, there is no distinction between asymptomatic or symptomatic infectious individuals. And lastly, all infectious individuals are detected or confirmed. Now, Octa uses this SIR model to calculate the reproduction number which they report to the media. Now, effective reproduction number is defined as the average number of secondary cases per infectious case in a population made up of both susceptible and non-susceptible hosts. Now, this is the model. This is the formula that they're using. Okay. Here, the gamma, so R naught, they're using R naught because beta over gamma, where gamma is 1 over 14, and then beta is fitted to the data. So actually, this formula is for the basic reproduction number, which is normally measured at day 1 or the start of the pandemic, and is defined as the average number of new infections generated by one infected individual in a fully susceptible population. So ito po yung model naman. On the other hand, the sub-technical working group for data analytics, of which FASTER, epidemiologists, other experts, and different agencies are members, has several models used for different purposes. So we developed an SEIR model for projecting case trajectories under different scenarios. Okay? I will show more details about this later. Now, from the SEIR model, there are additional models appended, such as model for economic losses. This is used to make a cost-benefit analysis when weighing the implications of community quarantine policies. We also have model for healthcare requirements. From the projected case numbers, target number of hospital and TPMF beds, healthcare workers, and medical supplies are estimated using the model. Now, we also have geospatial models and spatio-temporal models to describe the spread of disease at barangay levels. Now, for the reproduction number, similar to what Octa presents in the media, we use a model that is widely used in other countries. It's called EpiNow. Note that this model, LISA and EpiNow, are not homegrown models. Okay, the other models here are developed by FASTER with guidance from the sub-technical working group for data analytics. Now, finally, these are straightforward data analytics tools used by sub-technical working group, the 2-week growth rate, attack rate, epicurves, and so on. Now, let me say more about the SEIR model of FASTER. Maybe this is the model that is closest to the Octa model because it's also compartmental model. Now, while Octa uses an SIR model with 3 equations, mainly to generate the reproduction number, the FASTER sub-technical working group model is an SEIR model with 6 equations and is used mainly to generate projections based on scenarios that capture the effect of community quarantine policies, level of population compliance to health protocols such as wearing of face masks, face shields, and so on, and the timeliness of case detection and isolation. Incidentally, the model has been published recently in an international peer-reviewed Scopus Index journal, and there are 2 more related papers awaiting decisions. Now, this is my last slide. FASTER recently expanded its SEIR model to account for the effect of vaccination and the presence of Delta variants. So we now have what we call the SVEIR model. It has 14 equations. This model incorporates our local data of vaccination rate coverage, first dose and second dose separately, as well as the effectiveness of the different brands of vaccine against infection and then hospitalization. Therefore, the current model of Pfizer sub-TWG is able to take into account the effect of several interventions such as vaccination, compliance to minimum public health standards, and the timeliness of detection and isolation of cases. So these are the models for that we have. Thank you very much, Mr. Chair and Congressman.
Mr. Chair, salamat po doon
Yes,
sa presentation.
Stella, can you save for the second round? Apat lang kayo mag-interpolate.
O sige po, ano na lang po, for the second round na lang po. After.
Okay.
Opo.
Thank you, ma'am. Thank you. Next to interpolate is the Honorable Christine Singson-Mian. You have the floor po, ma'am.
Yes, good afternoon, Mr. Chair. Good afternoon to my colleagues and
Good afternoon.
other people that are here today. So before I mention my questions, siguro I'll just mention some short summary what was said already from the last hearing leading to my question. So last hearing po, based on Dr. John Wong, he's a member of the TWG for Data Analytics ng DOH IATF. He presented the infectious disease modeling na may dalawang criteria yon. So one is transparency, and under transparency po, parang we should find out the model, the funding sources, model structure, data sources, validation methods and results, and limitations. So yun po binanggit niya, and there should be validity. So may evaluation process siya. He also mentioned how policymakers use models and how the government should put in place a trustworthy science advisory process. So yun po ang naging suggestion ni Dr. Wong. And then Dr. Salvana's comment, if possible daw, there's possible inaccuracy of data and overestimation from Octa. So he mentioned something like that. And the lack of, Dr. Wong's comment also was the Octa's lack of transparency, particularly the limitations and uncertainties of the study. And then the better practice is to consider sana na Octa data should be added together with the other data that DOH, IATF, data analytics is trying to gather. Parang that was their suggestion. And then earlier, Yusek Rosette also just mentioned today to be cautious with data being shared to the public. And that DOH, IATF data analytics is willing to work with Octa and had in fact invited Octa to join their meetings. Last hearing, Professor Rai suggested that they have the right to express their opinions with a scientific basis and it should not be curtailed, and suggested a regulatory agency to verify private research groups. So yun naman po yung nakita ko na na-mention ni Dr. Rai last hearing. So my questions are, maybe Professor Rai, on your statement regarding accountability, you mentioned you're accountable to the scientific community. So when we say scientific community, sino sila, and what sort of accountability will this scientific community give you just in case nagkaroon tayo ng maling data that was shared to the public?
Your Honor, may I respond, Your Honor? Thank you.
Yes, please.
Thank you, Deputy Speaker Mihan, for your question. Our models are presented. There's a particular norm and value when you're part of a scientific community that when you do a scientific work, it is only validated when the community of scientists, your academic community, validates it. So you're always open to your models and contributions to science to being studied, critiqued, and corrected by your community. And that is what I meant by us being accountable. And Octa has been, through its work, produced almost every week, been utilizing fora, both academic and non-academic, to explain its model po. In fact, we have YouTube videos of us with press webinars just explaining po the model In fact, we've also, as Yusek Vergere, our friend, has correctly informed the committee. In fact, we presented with the DOH, and we have always been in coordination with the DOH whenever they request us to be with them. In December last year, they wanted us to come out with a projection for a possible Christmas surge, and and she can validate this. We submitted to them, and we joined them. No, when we submitted to the IATF, we had all our own submissions there. So that's part of our own process of accountability. Our public should be informed about how we do things and how we see things. What seems to be clear is that all models have their limits, including the DOH model, including the Octa model. What's important for models is explanatory bias. And so to answer your question, we are not just accountable to our scientific community, we're also accountable to our public in general. And the public, not all of them are scientists, can understand the complex math, no, can judge the model for its explanatory value. So when you look at the projection, it's not a prediction, but the projection and the trends, you will see it also actualized in real-time data. That, by the way, is provided also by the DOH. It's also provided by our hospitals. It's also provided by our IATF. So the model is judged by its projection, its own analysis of trends. Yes, Octa was first to talk about the country being in the early stages of a surge in July 28. But it's also one of the first research groups to project, no, that we are on a decline and that we're healing. We said this 2 weeks ago, and true enough, no, what's happening now is that we're moving. So the model that we are using is robust, it's valid, it's different from the DOH model, but it is, I think, as useful a model for the DOH. And part of the accountability is producing this report weekly with our names on it. And yes, we agree with Congressman Kimbo and yours truly, no, Congressman Mihan, that we should do even more to make this model more accessible to the public through websites. We're developing a new website, and all the models and methodologies will be there. The technical details. We have academics writing us, no, on a weekly basis, asking for our models from all around the world, and we have. And by the way, we're also submitting for journal. What you call this, for a review of a journal, our own model. And in fact, we have submitted the first draft of this to the committee for really as a way to be accountable po. And for the regular citizen, this is a way of making us accountable, because we're looking at our projections and seeing reality and comparing them. Thank you po for the question po.
And then, Mr. Chair, to my next question, because Professor, I mentioned before, like if there's disparities on their data between DOH, they just agree to disagree. But Mr. Chair, what's the consequence of having varying statements to the public then? May I know from Professor Reifers?
We have presented our model to DOH, and there are two different models. Our basic approach is to determine trends using the real-time R0, no? And we have a difference in, what I want to emphasize, Chair, is that while there might not be any unanimity as far as the scientific data is concerned, because we're looking at the world through two different models, all of which have limits po, but both are useful, that we have a solidarity po na we are all in this together. We want to get the best picture of the state of the pandemic in the country. And again, that we compare these models, and that we have the common objective of trying to inform our citizens so they can have so they can be empowered to make better decisions. So this is what I meant when I said that last week, that yes, there is the inevitability that we might have different results, and that we cannot completely agree on specific results of our models, but we are in solidarity with the government. We want to help the country get out of the plague that we are in. And I think, honestly, our contributions have helped I think the DOH can attest, no, that as far as messaging is concerned, whether it's pushing the compliance with minimum public health standards or following the government's quarantine protocols, we have been helping the Department of Health amplify those messages. We may have different views about it, but then again, they understand. The good people from Ateneo Faster have seen our model. We are also impressed with their model, and they know the intent and the way we're looking at things. So from the scientific standpoint, there I think is an understanding between us, no, that we're looking at things from a different analytical lens. Kasi SEIR ang kanila, amin SIR, iba yung assumptions namin, but that both can contribute to the useful, no, to provide useful information that can inform not just government but our citizens, so that both can make better decisions as far as dealing with COVID-19 is concerned. So that's the purpose and intent. It's a responsibility as social scientists, as scientists, to provide this research. And in other countries, you know, you have universities, no? Johns Hopkins, Imperial College in UK, Johns Hopkins in the United States, and in the United States, there are quite a number of universities are doing this. And we're not the only research group that provides differing interpretations. No? The UP Pandemic Response Team comes out with their own estimation of R and projections and trends. And they're very different from the trends being produced by the DOH. So we're not the only ones who have a different look at things. But then again, we're in solidarity. We all want to help one another, inform our citizens, empower our citizens so that they can make the best decisions to manage their risks. Yun lang po, Chair.
So, Mr. Chair, for maybe most people, kasi hindi naman nila maintindihan how these things are being explained, the models, the differences of data. So nangyayari po, I think if we provide different statements to the public, nagkakos ng distrust. It doesn't mean distrust lang sa DOH. Pwede rin nagkakaroon tuloy ng distrust sa Octa or even both pag nagkakaroon ng varying statements po tayo. So may I ask Professor Raj, if their group is willing to work with DOH IATF again, and if that's possible, how would you work together and be able to decide on what statements should be or what data should be shared to the public, kung possible po to na magkakaroon tayo ng agreement after this hearing and both will be able to work together. Kasi I'm so sure DOH also gets data from other private groups, not just Octa. Kaya yun lang, if there's just one private group na nag-i-issue ng statement na naiba from what DOH is giving out, yun, for sure yun, magkakaroon talaga ng distrust ang public. Yun yung nakikita ko kasi in effect.
May I respond, Chair? Chair? Okay.
Respond.
Yeah, okay. Thank you. Thank you for your question, Deputy Speaker Mihan. Yeah, we are. First of all, we are willing to work with DOH, and we have no problems with DOH. I think Yusek Rosette will note that we are textmates. We ask them about how we can amplify their messages. Yes, we've been very busy. Both camps have been very busy. That's why we haven't been working as much. The passion and the seeming difference that was amplified was really because all of us were scared of Delta. Honestly, we saw the impact of the Alpha surge and Beta surge in February and March, and we saw how many people lost lives and how it affected livelihoods. Octa's basic position was to go early, go hard. And while our position was never truly accepted in government because we just merely recommended, and that has to be established, we merely recommend, we defer always to government. In all our public statements, we always say we follow government. This is just our recommendation. This is just how we look at things. We defer to government. If you can just look at all our public statements, it's very clear. We defer always. The decision maker is government. And government decided, last July, to lock down. They did not use our data. They used the data of DOH. And DOH saw the same thing that we saw, that there was an impending surge with serious consequences if we did not make decisions at that time. And we believe the government made the right decisions, and we have amplified that position in media. Government made the right call when it decided to have an ECQ, and that to a great extent has affected the outcome that we are now, the good outcome. It has been influenced the good outcomes we are now experiencing today. Yun nga lang, Octa also sees not just when there's a tsunami of cases coming in. Octa also sees when there's good news. No, we also say that to the public. No, so we want to work with government. We just don't know how to do it. If could be some mechanism that can be devised. No. Then we will work with the IATF and the Department of Health, no? But of course, we want to continue providing the public access to our research, access to our monitoring reports. If that can be done while at the same time working closely with the Department of Health, we will be very happy to do so. And right now, informally, I think there's no problem working with DOH. We work very closely. When USEC Rosette needs something, we will. And Father Nicanor Austriaco, who's present now, can attest to that. Octa is working with government already. We're in the vaccine committee. We're in T3. There's nothing formal, but the thing is Octa fellows have been working. Octa fellows are working with PA Joey Concepcion and Go Negosyo on the leveling system. We had a meeting with DOH recently to talk about how we can improve the leveling system so that the business community can be, so it's more predictable and calculable for the business community. We have done that. So if we need to formalize it, we will. So we're open to working with government because we already are working with government. And we're solid behind the collective effort to fight COVID-19. That means working with the private sector, working with the national government, working with the academe. We're not the only research group here. There's a very good research group in UP. The UP pandemic is much bigger than we are, and with more experts. So we're ready to help, sir, Chair, and let us know how we can formalize that, and we will do it as soon as possible.
Yes, I'm looking forward that Octa and DOH will agree to work together, and we and have all their disagreements settled. And then to my last question, it was mentioned before that to maintain standards and integrity, there should only be one. Because I believe that Octa is doing two things, the public opinion surveys, and the other one is the research group. So is Octa willing to give up one for the other, or are you planning to do both still?
Chair, with great respect, Octa has the right to do research. All that we do is research, and there are two types at the moment. One is research, the COVID-19 monitoring research. The other is the public opinion research. And I think we have the right, we have the competence to do both researches. And I think we will continue to do so in the service of our public, the Filipino. And I believe there's no contradiction because our research in COVID-19 is also augmented by the findings of our public opinion research on COVID. We do research on vaccine willingness, vaccine hesitation. We have research in our public opinion research on the use of face masks and face shields and compliance with minimum public health standards, which we provide the public, which we provide the Department of Health this information also. So I think there, as a social, as a research organization, we have to be given the right to do research in service of the public. So I believe that we can do both, and we can do both very well. COVID will not be forever. COVID will end. And as a research organization, we have a research agenda. So we do policy research, we do public opinion research, we partner with academic organizations in and outside of the country to do research. So I don't see there's any contradiction, violation of any sort, no? When we do both. Yes, we learned a lot from the committee hearing to calibrate our messaging, and we have. I think Chair, maybe you can attest to this, that we have done so much, no, to operationalize the good suggestions of this committee during our last meeting. And we want to remain independent. We want to remain autonomous from any other state institution. We also want to continue to do what we have set out to do, which is to do public opinion research. Thank you.
Yes, and to the last question, will Octa still do political surveys?
You know, Octa does probes on the effects of COVID-19 on our citizens. It does a probe on urgent personal and national concerns. It does probes on socioeconomic concerns. The probe on the elections, it just happens to be an important probe at this time, but we don't do political surveys alone. Yeah, and in recognition of the importance of our work, we've been very, very careful about releasing these results. So I think we have to continue because, you know, public opinion research is important, especially for democracy. So, you know, it's the life of the country. Okay, the 2022 elections is important to the life of the country, and we have to understand. Okay, we have to do public opinion research on this. It's an important thing, and so we will continue to do so. But that won't be the focus of our research alone. We're doing research on wellness. We're doing research on the impact of COVID on our communities. We're doing research on our foreign policy. We're doing research on concerns, no, socioeconomic concerns of our people. So if one would just look at the internet, we have been releasing these survey results, urgent personal concerns. We've released also our COVID studies, which I think our bulk of our opinion research has been that. Ano ba ang compliance po ng mga kababayan natin sa pagsunod sa minimum public health standards? I think importante yung study namin kasi sa mga researches, kami consistently na naglalabas ng research na ganun. Ano ho ba ang vaccine willingness natin? Ano yung hesitancy? Ano yung reason po kung bakit hindi nagpapabakuna ng mga tao? Ano yung tingin ng mga tao sa response ng gobyerno tungkol sa COVID-19? So meron ho kaming malawak ho na pag-aaral na hindi ho lang ang pinutingnan namin yung political. Incidental lang ho, 3 probe lang naman po yung sa political, yung president, vice president, tsaka senators. Yun lang po. And it just happened na talaga may election tayo sa 2022, and it's important to do public opinion research because the elections of 2022 is important to the life of our country, to our democracy. We need to contribute meaningful research towards that. Thank you po, Chair.
Thank you, Chair. That's all.
Thank you, DS Mihan. Before we continue, I'd like to acknowledge the presence of Congresswoman Sharon Garin, Congressman Adriano Edcas. I'd like to ask, before the last interpolator, I'd like to ask a couple of questions to the representative of you, from the representative of DOH, Yusek Vergere. Hello, Yusek.
Yes po, Mr. Chair.
Yusek, I want to chime in doon sa sinabi mong last na opening statement mo na sila Octa, you summoned them sa meeting for a meeting because what was the purpose of that meeting? Yung initial meeting?
I really cannot recall, Mr. Chair, but one of the intentions of the department during the first time that we have asked for a meeting from them was for them to be clear and advise us on the assumptions that they use when they do their projection so that we can align. The second time that we were calling on them, I think that was the time that there was this difference in our case fatality rate computation and it was misleading the public. And this time, the second time that we have called on them, they did not attend. But after, I think, 2 months, we called on them again to finally clear this up, this case fatality rate computation. And they attended naman po and we were able to align and they were able to explain.
Yes, Yusek, kasi ang purpose nitong one of the purposes of this hearing is that we do not want the public to be confused in this time of the pandemic, that they are relying on the data of government. So what do you think? Are they confusing the public at times? Not all the time. I'm saying at times, are they confusing the public, because you're the official spokesperson of DOH. So what is your comment? Because it's you who is every day fronting the media and the public. So we want to help you that any group will not be subverting at the most and at the least confusing the public.
Yes, Mr. Chair. Actually, it has added to our task, no? Yun pong kailangan po namin ipaliwanag din yung mga inilalabas nilang reports. Yes, I am friends with Dr. Ranjit, Father Nick. We have this kind of collegial naman po kami. Kaya lang, syempre po, pag kami sa gobyerno, alam po natin ngayong pandemya, we are battling not just the actual cases, and this results to lives of people. We are also battling infodemic. And ang mga tao po ngayon ay gulong-gulo na sa lahat ng inilalabas natin. And it adds on the burden dun sa trabaho ng gobyerno kapag meron pong nakakapag-preempt, katulad nung announcement nung una na may surge, we have our metrics to use. When that announcement was done, our ICU utilization and healthcare utilization was just at 50%. So we were trying to wini-weigh po namin, binabalanse namin. Dahil nakikita namin, kinakaya natin, and we will be doing our part kapag dumating dun sa threshold namin. And unfortunately, the announcement was done. So the clamor was there. Even though we had our metrics at nandun naman talaga yung plano na magpe-preempt tayo early on, pero mas napaaga ang mga desisyon dahil nga po may lumabas na ganito mga statements. And that really doesn't help government at all. Hindi lang health ang tinitignan, pati ekonomiya kasi pagdating sa IATF. So, yun po mga ganitong instances, it really gives us a hard time. We are trying our best to have this kind of coordination with all of those who would want to help the government. Kaya lang talaga, wala naman talaga kaming formal na coordination with Octa. Hindi naman po kami nagkaroon ng ganun.
Would you say that there are too many cooks in the kitchen?
We do not like to suppress, sir, na pwede naman, di ba, as long as research was done well, the assumptions are transparent, and siguro sana mas maganda kung aligned din po sa amin. So yung una pong alok natin na sana lahat po ng projections, lahat ng systems ilalagay sa isang lugar, katulad nung inaalok dati ng gobyerno, sana ganun po para aligned tayo lahat kapag nagkaroon po tayo ng announcement.
Admit ko medyo nag-improve naman yung Octa since sa first hearing, pero prior to that, nanonood ako ng television, I monitored the Tri-Media. Minsan naunahan pa sila na-interview kaysa kayo. Doon ako nagugulat eh. So, rather than assisting you, parang sila pa yung nauuna yung magpa-interview, sila pa yung mas, hindi naman everyday, sometimes sila pa yung mas madaming coverage kaysa sa government. So, yun lang ang inaano natin dito, one of the issues being addressed. So, I'll just come back to you later kasi may gustong mauna sa akin na mag-interpolate. Ma'am, thank you po, Yusek.
Thank you po. Thank you po, Mr.
BH, you have the floor.
Thank you, Chair. Pasensya na, medyo nagmamadali lang po ako. Good afternoon, everyone. Well, I'll take off from what Chair Mike was saying and Yusek Vergere. I think if there is a lesson learned here is that hungry po for data rin yung mga tao. And I think that's one lesson that DOH should have learned also from this experience. I brought this up during the last hearing na meron din naman palang projections and like you said, may metrics naman din si DOH pero walang alam ang publiko about this. That's why when Octa released on something, naging media darling sila. So lagay natin doon sa perspektibong yun, dalang sinasabi nga ng media, wala silang naririnig na detalye or projections from our government. That's why bigla silang shift to Octa at nakikinig sa kanila. So now moving forward, Dr. Vergere and to Octa, how can we now have a proper coordination para hindi nakikipag-unahan, or that ang iniiwasan lang naman natin dito at ang ayaw din mangyari ng mga tao is that hindi mailabas transparent yung data. Ang importante kasi maipass through sa inyo like what Yusek Vergere was saying, but it doesn't mean that we will not disclose certain information to the public. So is there collaboration already between DOH and Octa as to how to go about this? Because Yusek projections and metrics are also important, diba? Dahil nahuhuli rin tayo or hindi tayo nagre-release, Octa felt the need to do what they had to do. Kaya nagkaroon ng fear-mongering among our, like you said, napaaga sila, di ba? Pero hindi rin kasi nila nakita, nag-a-announce ang DOH. So what now is our direction? Because this is in aid of legislation, so I want to find solutions to our present problems. Ano ngayon ang direction natin, Octa and DOH? Through you, Mr. Chair.
Mr. Chair.
Yusek Vergere.
Yes po, Mr. Chair. Good afternoon po, Congresswoman Herrera. Actually, siguro po ang pinakaunang dapat gawin, upo na lang po kami ng Octa para pag-usapan at makapag-align po kami dun sa mga assumptions na ginagamit, dun sa models na ginagamit, para makita po namin kung saan kami pwedeng magkaroon ng alignment. And then after that, we can discuss on these public announcements para po hindi nagkakaroon ng confusion din sa public. And we are always open naman po, like for example, they were able to see something in their projections that should be flagged to the public. Open naman po kami para umupo din with them, maintindihan namin ano yung dapat i-flag para pareho po kami ng sinasabi sa mga tao.
But again, this is not to control the flow of information, Yusek. May I hear from Octa, will that be okay with Octa?
Thank you, Congresswoman DH, and Chair. Yes, we're in complete agreement with Yusek Vergere. We've been working with her and her team. We will continue to work with them. And if there's a way that we can do early warning, because that's really what Octa does. It's just early warning, monitoring and early warning. Now, we understand, it's so hard in government because you have to go through a bureaucracy before you release the same findings and data. And so when we see an alert, now when we see, let's say, a tsunami, if we're on a beach now, we see a tsunami, we say, okay, it's coming, okay, but there could be a way that we could announce it with DOH earlier, and we could align, and strategize how we can release information. Of course, we want to remain autonomous. We want to remain independent. We want to continue doing what we're doing and informing the public. And we understand the limitations of government. They can't just come out quickly with their monitoring reports. And so there can be an arrangement, Congresswoman BH, where we continue to be autonomous, but at the same time coordinated and constantly collaborating with DOH. We agree with Yusek Rosel. We'll sit down with her tomorrow if need be. Or this afternoon if she has time.
Yes,
yeah.
If I may interrupt, kaya ko lang din gustong idagdag yun kasi you have to admit also that there are times that inaccurate din yung data ni Octa. Like what, yung example kanina ni Stella, yung dun sa kay Lino Cayetano na nagko-complain si Lino dun sa data na nilabas nyo, na sinabi niya, mali yung nilalabas yung data. So that's why hindi rin kayo pwedeng hindi naglalabas, hindi nagko-corroborate with someone kasi you don't have the perfect and accurate data as well. Nakakasira kayo, nakaka-create din kayo talaga ng takot. Just like in the case of Taguig, na very classic example, isa ni Lino. Bakit yung sinasabing ganito, ganito naman yung case sa amin? Ano ba nangyari doon? How come nagkamali kayo doon?
Okay. Chair, Ma'am BH, we talked with them. Yeah, they were really very disappointed. And by the way, this is not the first time. This is also the case with Baguio City, with some other local government units, no? Why? Because there's a dissonance po. May pagkakaiba po yung lumalabas sa data drop ng Department of Health at yung data na galing ho sa local government. Ang problema namin sa Octa, because we follow international standards, we only get data from the national agency, and that's the Department of Health. So lagi ho talagang may difference yung local government data, may lag po doon sa data ng department. Yun ho yung explanation talaga. At lumabas rin naman po yung nag-explain rin po kami sa Taguig, nag-explain rin po kami sa Baguio nung nagalit sila sa amin. So,
Precisely.
pero
Precisely
ginagamit
why
na
we
po namin kasi yung DOH data. So, in-explain naman namin po sa kanila na ito ho, nakita ho natin, ito ho yung
But
lumalabas sa DOH.
Mr. Chair, if I may interrupt, Mr. Chair, that's precisely why we shouldn't just publish without collaborating, without asking, kasi hindi nyo naman kabisado yung lugar eh. Diba? Hindi nyo kabisado yun. You also have to ask them, ano yung naging sitwasyon before you release data? Kasi nagpapanik yung mga tao. And I hope this is one lesson that Octa has learned from all this, diba? Kailangan nagko-collaborate tayo before we release information kasi nakakaroon ng fear yung mga tao. And I hope ma-keep in mind natin yan, Mr. Ranjit, Mr. Guido, and to all the Octa na let's collaborate para naman mas maintindihan yung data at hindi tayo naglalabas basta-basta ng data na ganito na nagkakakos ng panic sa mga tao. Ngayon, my next question is there a possibility, or in your study, I'm sure nakita nyo na that a lot of Filipinos don't want the lockdowns anymore, diba? I'm sure na nagka-poll kayo niyan, makikita nyo na talagang ayaw na ng lockdown. And mas matindi na yung call na we have to live with this pandemic, we have to live with this COVID, diba? At kailangan pagbutihin na lang natin ang treatment. So, meron bang pag-aaral ang DOH and ang Octa kung paanong, if we could already do such a thing, na we just have to learn how to live with this pandemic? Sa projections natin or sa nakikita natin. Mr. Chair, through you, I think Yusek Vergere has an answer.
Yes, Yusek Vergere.
Thank you, Mr. Chair and Congresswoman BH. Actually, ma'am, ito po yung ginagawa natin ngayong shift in policy that we have piloted here in the National Capital Region, that we are now going to be less restrictive by doing these granular lockdowns. When we tried analyzing what we were doing in this region-wide or city-wide lockdowns, nakita po natin that, for example, in NCR, based on the models na ginagawa po ng FASTER, yung data na kinukuha natin, nakita po natin na dito sa NCR, mga 30% lang po ng mga barangay ang talagang burdened with the number of cases. And the 70%, hindi po sila ganun kataas. It's not high risk. So with this, and plus the second na nakita natin na hindi na mukhang nag-work talaga yung mga wide na mga restrictions natin like ECQ, MECQ, we decided to recommend to IATF this shift in policy where we do granular lockdowns, where local governments can focus more on doing their response in these specific highly burdened areas. And we can do sa mga non-lockdown areas, we can do the other easing of restrictions katulad po ng ginagawa ngayon ng IATF na gradually ginagawan po natin ang mga pagtaas na or ine-expand natin ang pagbukas dito sa mga sectors na to. So ito po yung ginagawa natin and it's soon to be rolled out to other areas of the country as soon as we get the analysis for the NCR pilot.
Okay, so what is now DOH doing about yung hindi parehas ng data or mabagal ang catch-up ng data ng DOH at saka ng LGU? Kaya nagkakamali rin ang projection ng Octa. Anong sistema po ang gagawin po natin dyan? Ang dagdag ko na rin doon, hindi ba natin pwede rin idagdag yung ginagawa ng Mandaluyong dahil ang ganda ng presentation ng data nila. Vaccinated, ito yung naging cases. Non-vaccinated, ito yung cases. First dose, ito yung cases. I think that's a very transparent data that I would want na, and nalaman ko when I was asking Quezon City government to do the same, sabi nila they submit the same thing to MMDA and I think to DOH. So why doesn't DOH present the same thing to the public? Kasi ang natatakot ako dito sa may rule na vaccination, non-vaccinated, baka nagiging kampante yung mga vaccinated pero pag titignan mo naman yung data, hindi ganun dapat ang nagiging actions ng gobyerno.
Mr. Chair.
Yes, Yusek, please proceed.
Thank you, Mr. Chairman. Congresswoman BH, actually unang-una po, binabago na ho natin yung case bulletin natin ngayon. We're just trying to finalize our draft where vaccination coverage will be included and those fully vaccinated, how many nagkasakit, yun pong mga sinabi nyo, it's part of what we are going to include into our new case bulletin. The second, meron po talagang difference ang data ng local at saka ng national. Ang process po kasi natin, we rely on the local governments to encode and update our list para dumating sa amin. So usually, mas mauuna sila, mas may first-hand information sila. Kami po kasi, we still reconcile and validate our data sets. So yun pong sa Octa, kaya po may difference yung ganon. I think we use the same data set eh. So kailangan yung interpretation ulit eh, ang kailangan pumapasok kapag local governments. We've had this conversation, discussions with local governments since the start at talagang ayaw nila talaga yung ginagawa yung nirarank sila. Lalong-lalo na kapag ang ginamit natin na ranking ay yung actual number of cases because that will not really be reflective dun sa nangyayari dun sa kanilang area. So yung amin pong mga datos, may difference talaga with local governments, pero after 1 to 2 days, nakakapag-reconcile kami at nagiging pareho na po. Meron lang talagang validation process, Congresswoman BH.
Yes, thank you precisely. So please take note of that, Octa, ha, para hindi tayo nagkakagulo, especially sa local governments. And ang isang pang pakiusap ko through you, Mr. Chair, can we also concentrate on recovery rate? Napaka-importante po ng recovery rate and it seems hindi natin hina-highlight ito and that is one thing that I would like to request DOH and Octa to also concentrate on kasi ang ganda-ganda ng recovery rate ng ating bansa compared to other first world countries that people do not realize because hindi tayo nagfo-focus on that. Do we also expect a shift on that, Octa and DOH?
Siguro, Chair, I'll also respond kasi Congressman
Yes,
BH has given some very good suggestions, excellent suggestions. If people have noticed, because of the experience we had with Taguig and with Baguio, we now collaborate with local government units more closely. You know this, I can verify this, Congressman BH with Quezon City in particular. Quezon City is like a thermometer of the situation in the National Capital Region. And yes, we validate, we agree with the statement of Yusek Bergere. The difference in the validation process, is clarified over a short period of time. And local governments tend to say, tama rin pala yung data na nasa DOH. And they end up saying, okay, mukhang tama naman yung projection din yung Octa. Kasi we use DOH data, the official data. In fact, we want to take this opportunity to thank DOH kasi Octa would not be Octa without DOH. Wala kaming access sa data sa DOH, we won't be able to do our projections. And this is the best practice, international best practice among research organizations looking at COVID, that you only use the national data set of government. So the government's data set, which is produced by the Department of Health. And yes, we will include all of those new metrics that you suggested. And we will work with, in fact, if you noticed, we've also moved from a granular look at cities to a regional approach when we do our reports. We still do the weekly reports, but we do more regional perspective now because we're seeing that the situation in the National Capital Region is also improving. And I think any cursory look at the last 3 days of news will see that Octa has been working together with the private sector in relaying the improvements that we're all experiencing now. I hope the DOH also sees that also.
Mr. Chair, question ko lang sa Octa, Mr. Ranger, not to offend anyone ha. Pag naman kunwari, di ba, like yan, na-offend yung Quezon City before, na-offend yung Baguio, na-offend yung Taguig. When you collaborate with them, afterwards, wala naman tayong sinisingil sa kanila. Wala naman tayong nagiging
Wala po, you can verify naman po. You can take if you don't take a word for it.
Attack, collect, defend, collect tayo sa issue.
Wala po. Lahat po yan. And they can all attest naman. Octa has no government projects. It has not used no government funds in the activities, in its operations. And we do this talaga as part of our public service po. Yung pagtulong sa mga local governments po, normal. Ang dami humingi ng tulong sa amin po na wala ho talaga kaming kina-charge. And then you can always verify. And in fact, we can the city that we have been helping for the last year or so is the Quezon City po. You can always go to Quezon City and the mayor will attest that we've been helping on a weekly basis po. Because we're from UP po eh. Kapit-bahay, dito kami sa Quezon City. Kung di man lamang matulungan ng Quezon City.
I just wanted to make sure na talagang...
wala po talaga, wala po.
Yung income generating is dun sa rider questions lang ng mga surveys ninyo. Like you mentioned.
Sa survey lang talaga po, hindi namin kaya ibigay for free, ma'am eh. Yun lang talaga.
Of course. And we understand that. Music Vergere, ano pong masasabi nyo dun sa yung recovery rate? Baka meron naman sana we can focus more on that also.
Yes, Mr. Chairman. Honorable SB Bernadette Herrera. Ma'am, kasama po yan sa case bulletin namin na ipinapalabas araw-araw, yun pong recovery rate. And also when we do our
Sana
media brief,
ma-highlight natin. Ang sa akin, we have to highlight more on that kasi people need to know.
yes po, Congresswoman, we are taking note of that and we will be highlighting this more, especially during our media briefings po.
Yes, thank you. And then, gusto ko lang i-manifest, Mr. Chair, I'm just really disappointed dun sa liquidation ng UP. Hindi ko, kasi very clear naman yung bayanihan 15 million pesos for the establishment of a computational research laboratory in the University of the Philippines, Diliman, to process big data analysis for COVID-19 and other pandemic research. So talagang it's really for data analytics. Meron na bang sinubmit na liquidation ang UP?
Meron.
Sir,
Meron
may-
na, meron.
Tingin na lang akong copy. Yes.
Ipa-Viber ko ngayon sa'yo para mabasa mo.
Can
Comsec.
you please,
Mr. Chair,
Mr. Chair, can you please say that we have
Mr. Chair, may I
Yes,
respond,
I'd
Mr.
like
Chair?
to... Wait first, ma'am. Wait first. I would like to inform the SBH that of the 15 million, I think only
3.65, sir.
4.75 million was used for research grants.
Yeah. But
And I think for furniture, 4 million. Is that correct, ma'am?
so, Mr. Chair, actually, so I have actually, we only got 3.65 million from DBM. UP will have to still request for the remaining funds, so UP advanced. So for EO, this is the budget allocated for PS is 268,800. It's the actual utilization is the same amount. The MOOE is 6,731,200. The amount is lower than that in the actual utilization, but the EO is 8 million allotted, but it's 7.9 million utilized. But I just want to stress too that as of now, the laboratory, the computers are there, but the laboratory is not yet as operational as it should be because of the procurement and because of EO. So as of now, actually, sir, 14 million, Your Honor, 14,241,000 lang po ang budget allotted because DBM in its first NCA actually removed 700 something thousand as taxes. So in actuality, UP spent 14,700,761 pesos. It is more than the 14,241,000 that was allotted. But of that 14,241,000, 3.65 lang po ang nakuha pa lang sa DBM. Thank you.
Thank you.
Mr. Chair, when will this be operational? So you need help ba with DBM in releasing those funds?
No, sir. I know, ma'am. The operational is when, because of the ECQ and the delays in all of the procurement, I think the computers are there. The report actually has that. But the operational na umagana talaga siya na laboratory na siya will be, I suppose, this year. I think I can ask Dr. Guido for that.
When will it be operational? And then from then on, we
Yeah.
can expect na yung mga analytics natin, data analytics, magiging very efficient na to.
So I suppose it should be operational this year. So Mr. Chair, I cannot answer the details. So maybe Dr. Guido, who is on top of that computer research laboratory, can answer it if he is recognized, Your Honor.
Dr. Guido, you are
Yes,
recognized.
yes, Your Honor. Thank you. And thank you for the question, Deputy Speaker, BH. So we have purchased the computers. The computers facilities were already purchased. Hindi po 4 million yung furniture. I think it's a few just a few hundred thousand. The cabling and they're still waiting for the cabling because of the lockdowns that happened. Mostly work from home for the most part of the year, yung staff, and now we've just gotten back to at least the staff who will help set up the laboratory and even the yung SPMO ng UP, they're also on light schedule. So because of that, but we hope that before the end of the year, we can launch this big data laboratory, which would be a big help, not just in doing analytics, but in tracking data. We hope it could be a mirror for all the data that's COVID related in the world. So yeah, thank you, Mr. Chair and Deputy Speaker.
So asahan po sana namin yan, Mr. Guido, para naman yung intention why we put the funds there would be realized. Yun lamang, Mr. Chair. Akin naman po, I just wanted to ensure na hindi na tayo magka-create ng fear among our fellow men. We really have to go back to living with this COVID na sana, and I hope we could go there, yung granular lockdowns. Kung saan lang yung may matindi, then dun lang tayo mag-focus. And I hope we rethink itong mga nagiging discrimination between vaccination and vaccinated, kasi nagiging relax yung mga vaccinated, hindi naman tayo masyadong sigurado that the vaccinated are really safe. So I hope we could look into those things, kasi kasama rin yan doon sa ating mga presentation ng data. That's why I'm asking for transparency in the presentation of data, so that people themselves would really know the entire picture of our country. Yun lamang po, Mr. Chair. Thank you very much.
Thank you, DSBH. You will avail second round or?
Bahala na, Mr. Chair, kasi paalis na rin ako. Thank you.
Okay, thank you. I'd like to go back to Dr. Ranjit Rai. Hello, Dr. Ranjit. Hello. Hello,
Sorry,
hello.
Chair. Sorry, Chair. Nag-lag lang ng konti. Sorry, Chair.
Dr. Ranjit,
Chair, hindi ako doctor. Hindi pa tapos yung PhD ko, sir. Kahit Mr.
Professor Ranjit, you promised during the first hearing that you will go to your board or your officers and recalibrate your policy on dealing with media. Can I know what was discussed, or what can you report to the committee?
Sir, we agreed that we should, number one, in recognition of your very good suggestion, do more structured press releases. Second, we have decided not to comment on the new leveling system, for deciding on quarantines, because first of all, we're not very clear also how. In fact, we're helping DOH further strengthen and make more practical and calculable their leveling system, level 1, 2, 3, 4. So you'll notice we have not suggested, recommended. So basically, we followed in essence, no. And you don't take my word for it, Chair. You can see it naman. You can verify naman sa media.
No. Ang concern lang the committee.
We decided
lang the committee, Dr. Ranjit, is let's stick to the science and the figures. Avoid masyado. We're not saying bawal mag-side comment, no. Avoid masyado yung mga comments, side comments na will be construed as a policy of the government. We want to help. As said by Yusek Berhere, it makes her job more difficult pag sumosobra kayo ng mga pronouncements sa media. It came from her, not from me. So it means that medyo kailangan lang i-tame down ng konti. And my suggestion siguro, like yung mga other tinutularan yung mga those who came before you, like SWS and Pulse Asia, siguro mas maganda na lang yung press statement rather than yung mga interview na tigta 30 minutes na alam niyo naman yung media, madaming mga questions na leading. Those leading questions, alam na nila yung sasagot nyo. They are bringing you to that para masagot nyo yung ganon. So it makes the job of limited na nga yung nilalabas ng government, although sufficient in my mind, sufficient siya, pero limited na nga. Hindi pa natin sila rather than assisting them in their messaging, medyo it goes against minsan. Sabi na ni Yusek yan. So my suggestion is limit na lang sa press statements. Kung meron mang media tatawag, limit na rin doon sa press statement yung mga sasagutin nyo. Kasi minsan, pag yung mga, like yung nung first time tayo nagkita, September 4, I think, is nag-pronounce kayo by the end of September, baka 30 to 40,000 na ang cases. Something like that.
Chair, ay kaklaro lang namin para lang for the record lang, total verifiable naman lahat ng sinasabi namin. Wala naman kami pong sinabi na ganun. Pero yes, we did call na may projection kami for the end of September and of course for October. Pero hindi ho talaga umabot talaga ng 30,000. Tinaro po namin sa media. Yes, we agree.
Pero sa mga article nabasa ko yung number na yun eh.
Yeah. So we have to clarify. I agree with you, sir. We have to be more structured and
yeah. Actually, the mistakes comes siguro yung pag-interview na matagal. Yung press statement kasi if you the media will only report what is written in the press statement. You get what I mean?
I agree, sir. I agree. Pero Chair, we in recognition of our autonomy as a research organization, sometimes we need to explain then sana our tables.
Yes, we
sticking of course to the data, of course, and we're trying. I think the key issue has always been yung policy pronouncements, and we've already agreed with DOH that we will coordinate with them.
Okay, I'll get back to you. I'm not yet finished kasi may member dito wants to ask one question. Congresswoman Garin, you have the floor.
Good morning. Good afternoon, Chair. Thank you. May quick question ako kay Yusek Vergere. So kung ako ma'am, I'm a lawyer and I form a group with some economists I know to do this data analytics. Can we do that? Can anybody just put up and say
Mr. Chair?
Yes, please proceed. Please, you're recognized.
Can anybody just put up a group and then publish it in social media and media? Or does DOH have any restrictions on that?
Mr. Chairman, I will be responding na po.
Yes po.
Yes. Good afternoon po, Congresswoman Garin. First, we do not have any regulations in terms of groups being created and doing their own studies or projections and then publishing it. Wala pong ganon. So usually the practice would be that any group, in terms of health-related matters, because ang lagi namang pong source ng mga grupo rin would be the DOH data. So they would go through us through an informal manner sometimes, but usually when we try to share data with them already, we have agreements. Pero as to formal or official regulations or policies, wala po kaming ganon. So anybody can just do that.
All right. So yan yung kulang, ma'am. No? There is a need for guidelines on such.
Mr. Chair.
Tama
Mr.
ba,
Chair.
Yes, Congresswoman Stella.
Hi, Shawi. Can I also?
That's it. I'm good na.
Can I give a comment on your question?
Yeah.
Pero maganda yung tanong ni Boss Shaws. It's a very, very vital question. Kasi nga, ano yung rules of engagement in a situation na syempre, hindi naman pinagbabawal ang manaliksik. In fact, encourage yan. Lahat ng taong gusto mag-research. The more knowledge, the better. So the question is, ano yung rules of engagement? In a situation na wala, kaya importante yung peer review process. So I'm talking not as a member of Congress, but as a former professor and as a researcher. Kaya sagrado sa aming academics yung peer review process. Ibig sabihin, when we publish, we submit our publications to a peer review. So ibig sabihin, journals. And blind yan. So whoever reviews your paper, hindi ka kilala, and vice versa. So
Yeah.
that's why kanina nung pinapaliwanag ni Dr. Elvira na yung model namin has been subjected to peer review, yun yung ibig niyang sabihin. At
Alright.
yun din ang sinasabi ni Professor Rai na yung amin, kakasubmit pa lang namin sa peer review. So pagkilala naman ng mga academics dito na important yun. So that's how it is eh. It's parang unregulated in a sense na walang formal na nilalabas ang ahensya. But among us academics and researchers, yun na yung gawin namin. So important talaga yung peer review. Therefore, sana ang pinaka-ideal is magka-publication ka muna which is peer-reviewed. Na so nagamit na yung model mo na peer-reviewed na pwede mo nang gamitin kasi kahit paano meron nang nag-vet versus a situation na yung model mo
Congresswoman
hindi pa
Stella,
peer-reviewed.
paano
Yes.
Congresswoman Stella pag dumiretso na sa media, walang peer review?
Yun nga yung big question. Nalalaktaw yung ganon. Nalalaktaw
Chair.
yung proseso
Yeah.
ng peer review.
Chair,
Naputol ba ako?
Chair, I'll just ask.
Hello,
I'll
Kong
just
Stella,
ask
paano
Kong
kung nauna
Stella.
pa sa media, hindi na dumaan sa
Yes.
validation?
Yun na nga yung problema sa ngayon. Kasi nalalaktawan yung process ng peer review. So, that's where we are.
Yes,
It's a question mark.
Congresswoman Sharon.
Yeah, just Constels, if we do have regulations, especially with reason that this is COVID and this is, a national, not just a statistics issue. It's a national economics and everything. Would that affect the industry as in terms of credibility and freedom of speech, no? Kasi it would be ideal na meron naman sana na konting control ang DOH, no? On who says whatever. So I don't know or how you balance that.
Yeah. Ako Congresswoman Garin, ma'am, kasi I suggested to them. It's up to them if they want to follow or they don't want to follow because they are already saying that it's already abridgment to their freedom of speech. Pero this is different. This is an emergency case.
Correct.
We want the public to be informed with the right data. And I suggest they just give press statements that are limited to that paper that the media can write an article every day. Because yung lumalampas kasi doon sa mga nare-report sa media is yung mga interview na that the media ask them a lot of questions when in turn would lead to confusion kasi naiba doon sa actually fini-frame yung question medyo na para maiba doon sa pre-announce ng gobyerno. So parang ganon. Nangyari.
Parang
you
Chair.
said. Yes.
Parang simply, dapat yung numbers yung superstar, no? Hindi yung researcher.
parang ganun na nga, ma'am. Parang ganun na po.
Alright, thank you, Chairman. Thank you.
Thank you. Thank you, Mama Sharon. I'll go back to Professor Rai. Professor Rai.
Yes,
Hello.
Chair. Yes, Chair.
Oh, we're not here to your freedom of speech. That is the last thing in our mind when the authors of this resolution and I started this hearing. That's the last thing on our mind. We just want what Yusik Bergeri wants, which is create something that the public can use and public can analyze and make them informed rather than set confusion. Which is at times she said that is what is happening. So if I were you, I would listen to her. Sabi niya nga may open communication kayo. I'd strongly suggest na stick na lang tayo sa press statement. Kung magko-comment man tayo sa media, but you stick within the statement that you prepared yourself. Di ba? So yun lang po kasi actually I'd like to ask you a series of questions. First is, when did Octa start?
The Octa as an organization, duly registered with the SEC, started in 2019.
Okay. What was is it true that you said the purpose was to gain public PR, public relation, and you created this initially as like SWS, a polling company, correct?
Yes, we registered ourselves as a research organization.
Polling. You told me.
Of which polling, public opinion research is part, policy research is also included, and of course training also.
Okay, this Octa volunteer group decided to research on COVID as kawang gawa. Tama, right or wrong?
Yes, it's part of our public service, yeah.
And the purpose, one of the purpose, in addition to helping the public, was to make it gain credibility and make it, it's like a marketing tool.
I don't think so, sir. You can see naman from how we evolved there. We just presented our monitoring reports. And we gained credibility because of the reports, yeah.
Actually, Professor, like evolution takes years. You did not evolve. You skyrocketed to the top. So don't use the word evolve, because you skyrocketed to the top, and you already displaced the more longer existing firms like SWS, like Pulse Asia. So it's not evolution. It is 2019.
Is it okay, Chair?
2020 is only 1 year. Correct?
Yeah. Chair, is it okay if I respectfully qualify lang? I don't disagree with you that yes, we are a credible organization, but it takes time to displace great institutions like SWS and PAL.
Yes, nga. Pero what I'm saying, please do not answer until I ask you a question.
Thank you, sir.
Do not argue with the chair, Professor Rai.
Yeah. Yes, sir. Yes, Chair. Sorry.
We're trying to. I'm answering your questions based on the answers you gave me last hearing, which was recorded. You said there that you're using this so that you will be known. Correct or not correct? You are mute. You are mute. You are mute.
We did not intend. Octa has two research agenda at the moment. One is to do COVID research, and the other is to do public opinion.
Yes. But initially, when you were organized, there was no COVID arm. Correct or not correct?
Yes. Correct, Chair.
This was organized April-May 2020. Correct or not correct?
Yes, the research arm started April. Yeah. Yes, correct, sir.
So I'm saying that you were overzealous in presenting your findings to the media and not having it first, because Yusek Vergere said they called your attention only after months of you coming out in the media with your analysis. They saw it fit that to call you and arrange a meeting because there were already disalignments on your pronouncement and theirs. So we have to be. You cannot argue with that. Ranjit, Professor
No,
Ranjit.
I'm not, Chair. No, please continue, Chair. Please continue.
Yeah, that's what she said. So I'm saying that the months that you used to first present your figures to media, it already has affected the messaging and the information campaign of the government, which was attested by Yusek Vergere, who's the official spokesperson of DOH. So my personal opinion as the chair is medyo nagamit itong COVID dahil there were times na in my own analysis na na medyo mas madami pa kayong airtime than the DOH, which is not supposed to be the case. 'Di ba? So with that great power, sabi ko nga in my opening statement comes great responsibility. So in my personal opinion, you have not yet evolved. You will evolve if you learn from your mistakes. That's one of the evolutions of man, no? So if you don't accept our recommendations and you still you have you saw confusion as we are not here, we're just observers. As a legislative branch, we are here as observers and legislate bills to law that we think should be legislated because it is for the public welfare. So rather than doing that, and you will say that you are being, or your independence is being subverted, we suggest that you accept our recommendations and just stick with your daily press releases. That is your right. But minsan kasi, pag lumalabas na tayo sa daily press release na sobra-sobra na is nakaka-affect talaga sa public information campaign ng DOH. That is undisputed. That is undisputed, Professor Rai. You cannot dispute that. That is been said already by the official spokesperson. So please, medyo magkaroon lang tayo ng acceptance dun sa fact na yun. So next on the agenda on my questions is, how many members of the Octa Research got 250,000 from the Bayanihan 2 grant? How many?
May I answer that?
Yes, ma'am. Yes, ma'am.
7 out of 19.
7 out of 19.
Yes.
Okay, thank you. Thank you po. Professor Ranjit, of the 7 of the 19, can you tell me their names? The 7. Professor Ranjit, I cannot hear you. Hello? Unmute. Nakamute ka daw.
Okay. Chair, I'll read the names of the people who got the grant of 200. That amount was 250,000 for I think that was 12 months, no? So 250 divided by 12 months. This is the grant that's given by the Institute of Math to individual UP faculty members. So although UP, I think UP also has the list there. I'll read from my own list. Myself, Professor Guido David, Professor Michael T, Professor Benjamin Vallejo, Professor Rodrigo Ong, and Professor Alampay. I think that was it, yeah.
So is that 6? Kulang pa daw, 7.
Is it 7 or 6? Sorry.
Yeah, could you check, Ma'am Sinch?
So I'm not sure about, is Festine with you? I don't know.
No.
No. So it's 6. Sorry, Mr. Chair.
Okay, thank you. So with this funding, you're being partly funded in your personal capacity. Chappy?
No, sir, I heard you well. I heard you. Go on, Chair.
Okay, Professor Ranjit, so you know this funding is part of the government money, so that is the reason that we have jurisdiction over this, because we need to make accountable people who are accepting money from the government. So not because you are UP faculty, but because these people are, partly, not a majority, but partly being funded by the government, taxpayers' money. So, you submitted CVs of your members, board members. How many are trained in statistics and mathematics?
Well, there are 2 people there with math and statistics background, fellows. We call them fellows.
Who are they po? Sino po yun?
Sa team natin si Dr. Benjico at saka si Dr. Guido David. Also Dr. Benjamin Vallejo pala. I'm sorry, Dr. Benjamin Vallejo.
Dr. Benjamin Vallejo?
Yes.
Is he a mathematician or statistician?
No, he's a natural scientist, but he has training in statistics. Professor Guido David also has that.
So three. You're saying three names.
Yeah. Oh, and then Dr. Ko also is a mathematician by training.
He's not a doctor of medicine.
He is a doctor of medicine, and I think he is also he has he has training in math.
Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you only have 3 people trained in statistics and math out of 11. Is that correct?
Yeah. Oh, yeah. Yes, Chair. I'm
Okay.
sorry. I was told just now by my colleagues here that also Dr. Berba also has a training in medical statistics, and also Father Austriaco, who finished his MA in
Yeah,
engineering.
but in the CV of Dr. Regina Berba, their training is also only medicine, doctor of medicine.
Yeah,
so
but
you're telling me now that
medical stat, yeah, epidemiology
okay.
also.
Okay, that's only 40% of the people there have statistics and mathematical training. Is that correct?
Yeah, more or less, Chair, that would be good. Yeah.
So you've divided your group into 2 groups. So what group are you a member of, Professor Ranjit?
I'm a member of both groups po.
Both groups. So what is your role in the group for COVID?
Well, sir, I'm part of the social scientists, set of social scientists who help craft our policy proposals.
With regards to running models, you have a part in that?
Well, I've helped the group in defining assumptions, but the modeling part is really done by the mathematicians in our group.
Because you don't have a training in mathematics and statistics, is that correct?
Yes, that's true. I don't have a formal degree in statistics, but I had graduate courses in quantitative methods.
So your role is more of the face of Octa. Is that a correct statement?
The face of Octa is Professor Guido David. You'll notice that naman, sir, in the media. He's our spokesperson for.
Yeah, but also you also.
Yeah, I speak from time to time, but you'll see naman it's much less. I'm more the administrator, the fellow, part of the research groups. So I help manage the research teams.
Yeah. So let's my suggestion, I like to reiterate, because you cannot deny the fact in 1 year lang nalampasan nyo na yung SWS at saka yung I don't know if that's by design or coincidence lang or whatever. Basta, in my opinion, nalampasan nyo na yung SWS and Pulse Asia. So with that power comes great responsibility. So sana, rather than arguing with this committee, then you self-regulate yourself. Yes. And only stick to the DOH can survive with just having a 10-minute press con every day, and a Viber, in their Viber group, and they release the press statement of the number infected and number daily recovered. Why cannot you limit yourselves also and ikahon nyo, di ba? Medyo uncontrollable kayo to be honest. Medyo yun ang opinion ko, pero syempre narinig nyo rin yung opinion ng the member before me, si Sharon, one of our economists, si Representative Garin. So yan din ang opinion niya. So rather than for us to legislate laws that will make you be under the scrutiny and the regulatory powers of the DOH, which we don't want to do, please heed our advice. Because yung ginamit mo yung word na evolution, I strongly disagree. Hindi kayo nag-evolve. Kasi nag-skyrocket kayo. Di ba? Evolution takes years. Walang evolution na 1 year lang. So, please, to the members of Octa, please, because the pandemic is really hitting the hearts of every Filipino, and malaking responsibility nyo talaga. Kilala kayo. Kaya sana, tayo, maging part tayo ng solution, then being part of the problem. We have nothing personal against you. We're just stating as learned people what we are observing. Okay?
Chair.
So,
Chair,
number two,
yeah.
hindi lang kami nag-observe niyan. We were written by several nandito nga ngayon he is here now, Mr. Sergio Luis Ortiz Jr. They were the ones who made correspondence to our congressman and our speaker to look into the Octa group. So meaning affected na rin sila. So yun lang, nating personal. And I'd like to go to the second round of interpellations. Si Dr. Dr. Congresswoman Stella.
Salamat, Mr. Chair. My first question is for Dr. Elvira of FASTER. I'd like to take off where we ended earlier. So is it correct for me to say that your model allows you to simulate on lockdown policies? Ibig sabihin, you can check whether if you impose a hard lockdown, bababa cases, or if you impose lockdowns in certain areas only, meaning granular, bababa ang overall. Things like those. Tama po ba?
May I respond po, Sir Chair? We consider scenarios po. Based po sa mobility, we consider scenarios, hindi lang po yung lockdown, kasama na po yung ibang interventions like yung detection, the ability of to detect cases po. So combination po ng iba-ibang interventions na tinitingnan namin.
All right, so the short answer is yes. My next question is, sa pagkakaalam po ninyo, expert opinion ninyo, yun po bang SIR model ng Octa? Are they able to do the same thing? Meaning, are they able to look at the effects of lockdown policies?
I think the better person to answer po is Professor Guido David.
No, again, I just wanted to know your opinion as an expert because you showed us earlier what Octa does. Meron kayong pag-intindi ng Octa model. So base sa inyong pag-intindi bilang isang eksperto, ang tanong lang, isa tingin niyo po ba how the model is structured? Are they able to simulate on lockdown variables? Ibig sabihin, length of lockdown or kung saan ilalagay ang lockdown, whether NCR-wide ba yan, NCR+, things like those.
I think po, iba po ang gamit nila ng SIR model. They're using SIR model to calculate the reproduction number. So iba po yung paggamit nila ng SIR model. They're not using the variables po.
So in other words, pag nagko-compute sila ng R0 every day, the model does not really allow you to directly do that forecasting based on lockdown. Okay. So, Mr. Chair, I'd like to actually make a comment on the previous statement of Professor Rai na ang sabi po niya is iba-iba ang model na ginagamit ng DOH at IATF at saka ng Octa. At iba-iba din ang assumptions, pero parang robust naman pareho. Parang gano'n ang sinasabi na it doesn't really matter what you use, talagang magkaiba lang talaga sila. Ang sa akin po, Mr. Chair, pasensya na lang with all due respect, I beg to disagree. Kasi if there are two models in front of you, there has to be a model that is better. Hindi po ba? Sa akin, base lang sa nakikita ko, una sa lahat, yung FASTER model, meron na silang peer-reviewed publication. Tama po, Dr. Elvira? Tama po. Whereas yung Octa group na publication is still undergoing peer review. So wala pang definite na assessment on the model. That's number one. Number two, yung sinasabi po ni Dr. Elvira kanina na homegrown ang model ng FASTER. Tama po ba, Dr. Elvira?
Yes po. Yun po yung pinabri na.
Okay, so ang ibig sabihin, Mr. Chair, is yung assumptions po na ginagamit doon sa model ay talagang base sa Philippine data. As much as possible, nire-reflect talaga niya ang local conditions. Ngayon po, yung Octa model, Dr. Elvira, homegrown din po ba?
Kasi po nasa, Professor Guido, correct me if I'm wrong, I think it is found in the textbooks po. It's a standard model po yun. SIR
Yun
model.
yun din ang aking pagkaintindi. So, hindi siya homegrown, in other words. So, para sa akin, Mr. Chair, yun yung second source of advantage ng faster model. Gumagamit siya ng assumptions na talagang reflective of local conditions. So, yun yung akin. And pangatlo, nabanggit ko na earlier, the model is able to simulate on policy variables. In other words, they can make recommendations with respect to policies like lockdowns on the basis of the model results. So para sa akin, simple lang yun eh. Kaya ako pinakita po, Mr. Chair, yung slide ko kanina, kung sinasabi ng Octa na robust ang kanilang model, bakit po sila pumapalya? Nung sinabi nila na magpipeak pa lang ang cases, nag-peak na. Ang ibig sabihin kasi nun, Mr. Chair, is pag sinasabi mo na magpipeak pa lang ang cases, ang ibig sabihin nun, nervousin tayong lahat kasi pataas pa yan. Whereas in reality, pababa na talaga siya. So in short, they failed to predict the downward part of the curve. So kung nakikita nila yung pagtaas ng kaso, unfortunately, based on their last 2 or 3 statements, hindi nila na-predict yung pagbaba. Which is why I am concerned as an economist. Ang ibig sabihin nun, nagiging bias in favor of stricter lockdown policies ang nagiging implications ng recommendations or predictions ng Octa. So, yun po, that's where I'm coming from sa aking sasabihin na sa aking palagay, ako isang ekonomista, matagal din po akong researcher. Tignan po ninyo sa Google Scholar, I have a very decent H index. Ibig sabihin nun, yun yung measure ng mga publications po. So, masasabi ko po, expert opinion din po, palagay ko mas maganda po yung faster model. Pero ito yung tanong ko, kung mas maganda nga ang faster model, bakit hanggang ngayon, nandito pa rin tayo? Bakit tila wala pa tayong solusyon talaga sa pandemya? And for me, that's the most important question, di ba? Kasi tayong lahat dito nagtatalo-talo, datos, methodology, ano ba dapat, etc., etc. But at the end of the day, bakit nandito pa rin tayo kung nasaan tayo ngayon? Which is, may problema pa rin tayo sa pandemya. So baka yung faster, baka naging slower. So ano po, where are we today? Bakit po may pagkukulang? So hindi ko alam kung sinong tatanungin ko dito. Siguro si Yusek Vergere. Ano ba, dahil kayo po ang highest ranking official dito ng DOH. Saan na tayo sa ngayon?
Mr. Chair.
Please proceed.
Thank you, Mr. Chair. And thank you po, Congresswoman Kimbo. Actually, yung faster po na modeling and projections guides us on how we are going to deal with the pandemic, yung pong response natin. So they provide us with that guidance as to how we are going to plan for resources to be invested, what we are looking at in the next 2 weeks, by the end of the month, or towards Christmas. So that's the guidance that these projections provide us. We are highly reliant actually with our local governments when in terms of the responses. And ito po yung atin pong sinistrengthen nga ngayon. That's why we wanted this shift in policy, because we saw that there was this over-reliance of local governments to these wide restrictions that we were implementing in the past, yun pong ECQ, MECQ. And the gatekeeping indicators that were supposed to be intensified or implemented, hindi po masyado nagagawa. Katulad ng contact tracing, intensified testing, yun pong intensive din na active case finding. So ito pong pag-shift natin ng policy, we are now relying on local governments na sila na po yung talagang gagawa nito. Pag nagawa po nila yan, they can open up more sectors within their respective area. So that is the the status right now. That's why we are piloting in the National Capital Region, Mr. Chair and Congresswoman.
Ikaw wala.
So, Mr.
So,
Chair,
nakawala.
ang sinasabi po ni Yusek is nasa implementation. So, sige, let's wait po in the next couple of weeks kung talagang yung evidence natin ay nagagamit sa mabuting paraan. Now, let me now move to Octa. Mr. Professor Rai, balik po tayo dun sa nature ng grupo po ninyo. Tama po ba na non-profit ang Octa? It's a non-profit organization po.
Yes, Chair. Yes, Congresswoman Kimbo. Yes.
And kung tama po ang recollection ko from the last hearing, sinasabi nyo, you really don't have income. Tama po?
No, we're not, what I meant was we're a self-supporting organization. We're non-endowed. We're not supported by one person, one group. We rely largely on funds generated from our subscribers.
So, sabi nyo dun sa last hearing, wala kayong revenues, meron lang kayong charge na subscription fees. Tama? Tama
Yes,
po.
kasi non-profit kasi.
Magkano po yun?
Hmm.
Magkano po ang subscription fees?
Ang subscription fee namin for 3 closed questions is 200,000 pesos po. It's public kasi
Magkano po ulit?
200,000.
200,000. 200 for 3 questions.
Yes po.
So, in short, sa lahat ng ginagawa ninyong research and you gave the, a wide array of these topics, yun lang pong pagdating sa survey, doon lang kayo nagkakaroon ng some inflow of resources.
Yes po.
And it's in the form of subscription fees.
Yes po.
And
yes.
at the same time, doon sa last hearing, ang is hindi naman po kayo nagbabayad ng sweldo or any form of allowance dito po sa ating mga COVID researchers. Tama po?
Yes po. Yes po.
Okay. So, and sinabi nyo rin po dun sa huling hearing na wala po kayong clients na LGUs. Tama po?
Yes, ma'am. Yes, ma'am.
So, ang sinasabi ninyo, you can say for a fact that no single LGU in this country has ever paid for subscription fees.
Yes, ma'am. Yeah.
Not a
100%, yes. Not a single one.
And moving forward, you do not intend to do that.
Yeah, there's no product that will require the LGUs to pay for. We cannot accept government money in a sense. In that sense, Congresswoman Stella, we have subscribers. Some of them are from the private sector. Some of them are in the Senate and in the House. Okay, we have that kind of subscriber set similar to SWS and PULSE. We have no subscribers from the local government, no local government itself.
Pero some
no
are
government entity.
some are senators, some are Congress people, meaning affiliated with districts.
With districts, yeah.
Okay, so in that sense, hindi po ba meron pa ring potential source of conflict? Ibig sabihin, example, yung distrito ko, halimbawa lang, hypothetical ito lahat, yung distrito ko, nagbayad ng subscription fee sa'yo kasi gusto namin magtanong ng 3 questions, so nagbayad kami ng 200,000. So ngayon, meron na tayong relationship. Hindi ba nagka-cast yun ng doubt on your assessment of COVID of my district?
No,
Mr. Chair, what I'm saying is, it's actually possible na wala talagang conflict of interest sa katotohanan. However, sa mata ng publiko, hindi ba magkakaroon ng ganong shadow of doubt? Kasi nga, malalaman na nagbabayad ang distrito ko sa Octa ng 200,000 and at the same time, Octa also includes Marikina in its listing of cities dun sa pag-assess ng COVID. Yun yung sinasabi pong kanina ni DS Christine Mihan na hindi ba may potential conflict of interest. Ang sinasabi natin, hindi natin sinasabi na actual na meron, hindi. Ang sinasabi natin baka may potential, meaning na e-erode
ang value ng information na gina-generate ninyo because we have a transactional relationship. Yun po ang ibig namin sabihin ng potential conflict of interest.
Chair and Congressman Stella Kimbo, we assure you there will be no conflict of interest. First of all, the data we produce, we get from the Department of Health. So it's verifiable, you can validate it, and the methods that we're utilize are accessible to all. So and when we do our RNOT studies, we do it on a regional level, Congresswoman. We don't do it at a district level. And the data that we get can be validated, can be verified by anyone because the data drop of the Department of Health is accessible po. And then we use established ways of calculating ADAR, positivity rate.
Mr. Chair, I've been doing research longer than Mr. Rai. Alam natin, it's more than the data drop. It's how you assemble the data, it's how you clean the data, it's how you subject the data to analysis. And in the end, kahit na pareho ang data na kinuha natin sa data drop, maaaring magkaibang conclusion natin. And Mr. Chair, tingin ko maybe the best person to ask is not really Mr. Rai, but maybe other people. So I'd like to ask first the other members of Octa, how do they feel about Octa doing both COVID research and at the same time doing political polling? Baka pwede natin tanungin si Dr. Michael T. If it's possible to ask
Dr.
him.
Michael T.
Yes.
Dr. Michael T.
Yes, Mr. Chair.
Ma'am Stella, you can ask a question to Dr. T.
Salamat, Mr. Chair. So, Mr. Dr. T, kung nakikinig po kayo kanina, ano po yung pakiramdam ninyo? Do you feel comfortable that your group, one part of the group does COVID research and you do it for free, kawang-gawa lang talaga, serbisyong publiko. But on the other hand, meron ding arm ang Octa group that does polling for politicians like senators and congresspeople.
When I joined the group, it was really about just the COVID-19 research, Mr. Chair and Madam Congresswoman. Number two, some of the researches that were part of the survey that was done by the group included my interest in mental health, stress. Number two would be the use of or following health protocol. So doon po nakasama yon. Ngayon, doon sa mga merong question about presidential, vice presidential, and senatorial surveys, these are part of their question. There's nothing I can do about that. Really, in the same manner that the group does not interfere with my other researches. So that is how I feel about it. We compartmentalize it. In fact, many of those, or maybe we can say majority of those working on the COVID-19 research has nothing to do with the question on presidential, vice presidential, and senatorial survey. But when we get the results of the public health following, we also use it because we need to put that and input that into our discussion when we talk about the models and the results of analysis that Dr. Guido David is putting out.
So, parang lumalabas, Mr. Chair, Dr. Tina, I hate to use these words, pero parang wala naman kayo masyadong pakialam sa Octa. As long as they let you do your thing and you are allowed to be called an Octa fellow, okay na.
As long as we get the data and then we analyze it and then we are able to contribute to the discussion.
So in short, Dr. T, kahit na sabihin natin na nagkakaroon ng distrust ang public sa Octa as a whole in terms of how they conduct their research, okay lang po yun. As long as ang importante po sa inyo is meron kayong autonomy sa pag-conduct ng research at meron kayong access to data as well as some resources. Tama po?
hindi po tama na okay lang sa amin. When there is already public opinion that is also adverse to our reputation, we initiate discussion. We tell each other, how can we improve so that we can further help our society in our whole of nation response. It cannot be that we act in a vacuum. We always try to listen. And when we listen, we don't just listen to what the media is telling us, but also to private groups that are interested in what we are saying. So may mag-feedback. Katulad din po ng may nag-feedback sa committee, meron din mga nag-feedback sa amin kung mali na yung sinasabi namin. In fact, halimbawang example, si Dr. Salvania, we always meet each other in the wards when we take care of patients that are referred to both of us, mainly pasyente ko na he takes care too. We also discuss the COVID situation. So when he tells me something is not totally acceptable, I also try to inform the whole group how we can improve what we are saying. Ganun po yun, Mr. Chair and Madam Congressman.
Mr. Chair, my next question is for Dr. Guido. Dr. Guido, Mr. Chair.
Yes, please proceed, Dr. Guido.
Dr. Guido, I'd like to ask you just one simple question. Bakit po walang ekonomista doon po sa listahan ng tumanggap po ng research grants? Did you consider economics as a irrelevant field for purposes of designing COVID policy? So, tinitignan ko po yung listahan. Marami po from Institute of Math because nga, computational research lab siya. Pero based on our discussion earlier, sabi nyo, hindi naman naging faithful doon. Ang naging importante is COVID. Pero ang karamihan po sa Institute of Math, College of Medicine, Department of Pol-Sci, Environmental Science, School of Statistics, Public Ad, Computational Science. Pero wala pong economics. Na alam naman natin sa ngayon, the pandemic is really about health and the economy. So hindi kaya ito ang dahilan kung bakit pag ang lens po natin, unfortunately, nagiging bias against the economy. Kasi yun ang nagiging, pasensya na, pero yun ang talagang, kung meron man criticism against your group, of course, everybody's appreciative of what you do. Kung meron man criticism, it's really that, na it seems to be overly biased for very highly restrictive policies.
Yes, yes, Congresswoman, that's a very good point. Actually, it was on short notice because we were, as we mentioned, hinahabol namin yung deadline for the liquidation of the funding. I mean, I wish you applied for one of the grants because, we would have happily, given to, an economics expert. So possibly for the next round, if there's going to be a future, future funding, we would definitely prioritize or at least add to the to the possible list of awardees an economics researcher. We do have statistics researchers there, and as you pointed out, yes.
Salamat sa job offer, Professor. Pero may trabaho na po akong iba. Do you know, are you aware that there's a health economics program in the UP School of Economics? And are you aware that there's a health economics lab in the UP School of Economics? And finally, are you aware that it is considered world-class as published in the Journal of Health Economics by the #3 health economist in the world, Adam Magstaff? There's a world-class health economics unit within the UP Diliman. And it baffles me that you had not been able to tap into this wealth of resources. So my last set of questions, Mr. Chair, is for maybe both Yusek Vergeire as well as Vice President Cynthia Bautista of UP. So my question really, and maybe comments na rin, Mr. Chair, is paano yung moving forward? It's really the moving forward. So maliwanag naman na meron tayong problema. It's a situation na bakit ganon. Meron naman data analytics ang gobyerno, pero ang nananaig parate is isang private sector group na tila kulang ang transparency, kulang ang accountability. How do we move forward? So I'd like to propose a certain number of rules of engagement. Kasi para sa akin, yung paulit-ulit na sinasabi ni Professor Rai na willing po kami makipag-meeting sa DOH. Pasensya na po ha, pero parang feeling ko, we shouldn't end there. We should really talk about the how to engage. Okay, so ang first ko na tanong is, paano yung peer review? Alam natin that the gold standard for quality assurance is peer review. But that takes time. But despite that, congratulations to the FASTER group kasi meron silang peer-reviewed publication. Okay, sabihin natin, peer-reviewed publication is too much to ask for at this time. Ano yung next best? Should it be being transparent in your research methods? Writing your research methods in a way that it is easily replicable and therefore can be tested by anyone? Is that something that you would agree, Ma'am Bautista? I mean, you are tama po ba you're the Vice President for Research?
Academic Affairs, which includes research.
But you once held that position po, Vice President for Research. Tama po?
No, the Vice President for Academic Affairs handles research as well.
Oh, there you go.
So I think
forward for peer review and then maybe transparency.
So I think for the peer review, that's part of our, as you said earlier, that's part of our culture. That the culture of publication is really part of the culture of the university. So I guess what you are saying, our Octa colleagues who are faculty members, I cannot speak for Octa, I can just speak for the faculty, is that really clarifying and yeah, you're saying writing and publishing and putting it out so you have a peer review. But I think moving forward, if this was not done very fast, diba? Because the money came in November, what is necessary is to get the different groups of UP doing COVID work or doing health. As you were saying, the economics group was not even included. So I guess it's really convening, and even the Resilience Institute group, we have different groups in UP doing work without knowing what the others are doing. I guess even before the publication, the peer review of the community, diba? A bigger community than just a small community of people, for instance, from the Institute of Mathematics or from the College of Science. So that I guess that what I'm getting from this discussion is really the need to bring together, at least in a discussion of issues, including a discussion of methods, a discussion of who should be part of it, a discussion also of terms of engagement with government. So I think because the Philippine Genome Center is under me. So we have units in the university, the Philippine Genome Center, the National Institutes of Health. They are government. They are as an institution working with government and are the ones who are actually following, I think, working closely with DOH. So it's the terms of engagement of our individual faculty, diba? Who in a time of pandemic. I guess that's the discussion. But that's an open discussion. And that is what I'm taking home from this meeting.
Thank you, Prof. and Mr. Chair. Just a few more. This is for you, Sec Vergere. Pag halimbawa po, no, niyakap natin ang COVID researchers ng Octa, ano pong itatawag sa kanila? Can they be called like DOH fellows? Pero of course, they continue to keep their Octa affiliation because they like that. But can they also be called DOH fellows such that when they are interviewed, they can say whether they are being interviewed as a DOH fellow, in which case they carry the official line of the agency, or if not, they can simply say, I am speaking as Professor Guido. I am not, my views do not reflect the views of the institution. Is that something that can be done? You, Secretary.
Yes, Mr. Chair.
Please respond. You're recognized.
Thank you, Mr. Chair, and thank you, Congresswoman Kimbo. When if and when any of these experts come into and work with DOH, we call them our experts. And it is not just part of the Department of Health, Congresswoman Kimbo. They will be part of our data analytics team. But when you are part of the data analytics team of the IATF, there are rules of engagement already. So you cannot just speak, just being, for example, Professor Ranjit, cannot just speak on what we do. There are official spokespersons, there are official channels, there are timing, official timing of when do we announce. And these are the things that has to be complied with if they will be part of our data analytics team. Because that's the channel which I am thinking right now, Congresswoman Kimbo, that they should be part of our data analytics team so that for lack of this time for peer review, the actual process, when you are part of the data analytics team, it's comprised of different experts, and also we have economists, the specific government agencies are also there. So there would be this vetting process between and among our experts on the methods, on the processes, and we can all align. But after that, with the results that we will get, there would already be rules of engagement.
Pero Mr. Chair and Yusek, syempre, itong mga teachers naman, syempre, lagi kami nagsasalita sa classroom. So, obvious naman na in certain situations, they can freely speak their mind because yun naman ang kultura ng UP, meron po tayong academic freedom, except magsasalita sila at lilinawin nila na hindi yon ang official na linya ng DOH. Tama po?
Yes, Mr. Chair, I'm going to respond na po.
Yes, sir. Yes, ma'am.
Yes po, Congresswoman Kimbo. Opo, yung amin pong mga experts naman, they can freely talk to the media, give their opinion. Basta they are as the expert. Halimbawa si Dr. Edsel as Dr. Edsel, but not as part of the data analytics, not part of DOH. Kanila pong opinion yun, kina-qualify po nila yun.
Salamat sa clarification, Mr. Chair. Huli na lang po. Kanina we were talking about potential conflict of interest. Ang pagkakaalam ko, again, bilang researcher, former member of the academe, kami po, every time we submit a journal, a manuscript to a journal, we always indicate potential source of conflict and potential funding source, and funding sources. So those are two things that we always disclose for every research that we publish. So I'd like to ask Professor Rai first, maybe if this is something that they adopt as a practice. Pag sila po ba ay may publications, ini-indicate ba nila ang funding sources and potential sources of conflict? Of course, based on our discussion earlier, hindi tayo nagkakasundo as to what constitutes a conflict of interest. Pero sige, gayon pa man, is this something that you do?
You know, the University of the Philippines has a very strict ethics review system, and yes, we follow all of that. In fact, you cannot anymore submit papers to peer-reviewed journals without stating the ethical framework of your research. So, saan ang galing yung funding, kung may conflict of interest.
Chair Mike, you're under oath, Professor Raya. I've seen your bulletins. Wala pong ganong klaseng disclosure. Wala pong ganong klaseng disclosure. Lilinawin ko lang. So, I was just being polite and asked you, pero I've seen the Octa bulletins, wala po. So, Yusek Berhere, is this something that you will consider adopting as a possible guideline? Kasi maganda po, maging maliwanag na kung meron tayong DOH fellow na magsusulat, at least maliwanag kung meron mang conflict of interest at maliwanag kung saan ang galing ang funding kung meron man.
Yes, Mr. Chair and Congresswoman Kimbo, we have non-disclosure agreements that we sign as an agreement with our experts. Actually, faster meron po sila with us. At saka yung iba pa ho namin expert groups. Meron din ho kami nung declaration ng conflicts of interest among all of our experts. They are made to sign before they work with us po.
That's good to know po. So yun lang po, those are the things lang po, Mr. Chair, na naisip ko for the moving forward kung finally po magsasama-sama na nga. Of course, at the end of the day, pinakamaganda pa rin, and I stand by my position earlier, yung US model na may isang government agency in the US, it's a US CDC, and tinatanggap nila ang mga forecasts sa mga findings ng bawat na maraming mga private universities. And in the end, sila po mismo ang nagve-vet kung ano kaya ang maganda ditong sundan na forecast. Kaya lang, I don't know, if that's something, Yusek Vergere, as a final question na talaga, is that something that you would consider apart from the possibility of inviting
siguro
the
pwedeng
Octa people?
Department order siguro kasi this involves public health eh. Kung yan ang faster way na magawa ng regulation, maybe ma-consider Yusek Vergere itong suggestion ni Congresswoman Stella.
Yes, Mr. Chair and Congresswoman Kimbo, actually, as I've mentioned a while ago, during the early part of the pandemic, the Department of Science and Technology was doing just that, inviting all of the researchers and those doing projections with these models to come and work with the government, with the data analytics team of government, so that we can compile in just one system and then, made to choose or try to analyze all of these models. Kaya lang po hindi siya nag-push through. And maybe we can again discuss with DOST kasi yung expertise din po kailangan namin. So pag-usapan po namin, and yes, we are very much interested in that also.
Salamat, Mr. Chair. I have no further questions.
Mr.
Salamat
Chair.
po, resource persons.
Mr. Chair, can I address? I'm from the United States.
Yes, I will recognize you later after two people. Please wait.
Okay. Well, I'm just responding to the most recent conversation about the U.S.
Lined up. There is a line after Mr. Bienvenido Oplas and Dr. Jody Damashon. Then I will have you as the last after them.
Thank you, po.
Thank you. Any more, Congresswoman Stella?
Salamat po. That was my last question po.
Okay. Because Mr. Bienvenido Oplas Jr. gave us a position paper and I read part of it. Maybe you can give a 5-minute summary, Dr. Bienvenido Oplas Jr. of your position paper, including the findings, recommendation.
Yes, good afternoon, Congressman. Can you hear me?
Yes.
Hello? Yeah. I sent my revised PowerPoint this afternoon. I'm not sure if the Secretariat has received it.
Yes, received it.
Yeah.
Maybe you can tackle your
Yes.
your recommendation.
Yeah, very quickly. I counted 5 instances of fictional false prediction by Octa. One is about the super spreader events. False prediction number 1, super spreader events, where they talk about super spreader of distancing, about the Black Nazarene, and they predicted that there will be a super spreader event. It did not happen. Okay, false prediction number 1. False prediction number 2, they talk about circuit breaker hard lockdown. Hard lockdown is favorite of Octa, and they proposed hard lockdown twice, in March 19 and in July 27 of this year. And in both instances, I showed data that what the hard lockdown that he have proposed actually did not, to supposedly to arrest the surge, did not happen. Okay, and false prediction number 3, longer curfew can reduce cases. So there was a lot of interviews by media interview. I showed a screenshot by Guido David saying that yes, bababa ang cases because of this curfew, and it did not happen. Okay, so false prediction number 3. False prediction number 4, they said that there will be more vaccination will reduce cases, and what actually happened was the reverse. After the mass vaccination of March 1, cases have jumped to the roof, and false prediction number 5, the exaggerated projection of cases, and I was citing here the data by Congresswoman Stella Kimbo, who we belong to the same school, UP School of Economics, and that. So my point here, Mr. Chair, is that, and of course, the economic damages of prolonged lockdown, because ITF to Octa. So, like for instance, the GDP level of 2020 is equivalent to the 2017 level of GDP. Practically 3 years of economic achievements have were erased. And for 2021, the projection 4.4 will be, GDP size will be about 18.3 trillion pesos. That will be equivalent to 2018. So 3 years of economic achievement have evaporated because of the hard lockdown, because IATF listened a lot to Octa. So next, my conclusion is that Octa has made a lot of at least 5 false predictions, and they have no humility to admit that they have made a mistake. They just keep from one mistake, false prediction, create another false prediction. There's no humility to admit of the mistake, and therefore I think you have already articulated, Mr. Chair, that Octa should be censured. Thank you very much.
Thank you. Thank you po. Next to give his summary on his presentation is Dr. Jody Dalmacion of CDC Philippines. Dr. Jody Dalmacion, are you here? Hello, hello.
Opo, I'm here, sir.
Yes, I'm giving you
Okay.
6 minutes to present your
Sir, nakikita na po yung shinare ko?
Oh, hindi, nakikita lang yung menu. Wala pang file.
Okay.
Yung menu screen ng file. Ito, naka-highlight yan. Paki-click mo yan, Octa PPT.
Anyway, sir, in the interest of time, ito lang po ang masasabi. I'm sorry, I have my PowerPoint. I do not know why it's not coming out.
Andito po sa upper right mo. Upper right, yan. Andiyan po yung...
Open
na po. Diwali na po. Okay na yan. Ano nyo lang po.
Okay. Here ho, nakikita na po nyo?
Hindi po. Diwali na po.
Anyway, sir.
Na-receive naman namin yung PowerPoint nyo. Gusto ko lang kayong pagsalitain on the record.
Okay.
Yung mga input nyo.
Thank you very much. May tatlong responsibility ho ang researcher. One of them is disclosing the conflict of interest. One is communication. And one is a judicious and transparent use of fund management. No? So, hindi ho talaga faulted ang Octa magsalita. Ngunit in their discussion, they should avoid alarmism and complacency when commenting on public emergency. And they have a responsibility to assist the media while recognizing the independence of both parties. And the committee, which is this committee we call on freedom and responsibility in the International Council for Science, says that communication is two-way. The scientists should not only present their findings, but also prepare to take into consideration the public needs and views. Katulad ho ng unang
Ma'am, may camera ba kayo? Para
may
yan na.
camera ho. Ito na.
Yan na, nakita ko na yung yung PowerPoint.
Apo, ito na po. So, ang conflict of interest naman, sir, it's actual, potential, or perceived. So, yung sinasabi ho ni Dr. Rai na wala silang conflict of interest, hindi ho sila ang pwedeng magsabi noon. Kailangan ho nilang i-disclose kasi the mere existence of a conflict does not imply wrongdoings because some cases are unavoidable. But you have to declare what you perceive, hindi ho laging actual yung conflict of interest. So, it can be evaluated by the colleagues. Now, when I was requested by CDC to present, ang sabi ko, what is vital? Communicating information that is official but not credible, or credible but not official? Or should you aim for both, official and credible? Katulad nung sinabi ni DG Domingo na pang-animal lang ang ivermectin, no? So may example ako dito, sir, noong December 17, 2020, sinabi ni Yusek Singh Vergeire that there will be a surge. It's not a question of anymore of if a surge will happen, but when and by how much. Yung mga ganong declarations, sir, are ambiguous. And it is not helpful to the public kasi may hunger ang public ng communicating what is happening now during the pandemic, especially na nasa pangalawang taon na tayo. Ngayon, ang Octa, sir, sila ang nagsasatisfy ng need na yon, lalo na pag ina-approach sila ng media. So, sabi ng expert noon ng Octa, there will be a spike of 4,000 a day from the current average of less than 5,000 by the end of January. So binalikan ko po yon. So that is a number, sir. Very tangible yon. But is it valid? So tiningnan ko po yung sinabi ng Octa noong December 17. Makikita po ninyo na tama sila, no? When they were declaring that on December 17, 1,500 ang cases a day. Ngunit at the end of January, as both of them predicted, hindi ho nag-surge. Ang surge is ang number ng cases is 2,102 or a 7-day average of 1,714. In fact, sir, hindi nila na-predict itong late March na I think nagdi-declare na dito, nag-uumpisa na po ito kasi sa India may warning na po na may Delta. No? So medyo huli sila. So ang makikita din po natin, I don't know kasi I don't see it here, na meron some problem with data kasi ang data ng kinukuha ng Octa is what you call a data drop. So hindi ho naman kasalanan ng DOH kung gagamitin nyo ang data. Ang responsibility ho ng researcher is to clean and manage the data. And when they cannot clean or manage, may limitation talaga dahil sa data, they have to discuss that when they are converse with the media or the public, ano ang limitation ng sinasabi nila, which unfortunately they fail to do. Okay? So, ano ba ang tinanong ni Congressman Kimbo, ano ba ang papel ng modeling? Sir, very specific ang mathematical model for the transmission of disease during to the medical community. Hindi lang para mag-project ng cases. Nagpo-project ka ng cases para makita mo ang behavior ng disease, ngunit para also to implement public response. Hindi mo maiintindihan paano ka magre-respond kung hindi mo alam na asymptomatic pala nag-i-spread, nang asymptomatic pala there's 8% chance of transmission versus asymptomatic with 40% chance of transmission. Kaya in a house, in a family, or in a workplace, isa sa 5 hindi siya mag-present ng symptoms maski COVID positive na siya. So pag hindi mo alam yon, hindi mo alam na source of transmission siya. So ang mathematical model, sir, is just not a projection. It is a means for DOH to implement measures that can control. And in doing so, can inform the public ano yung gagawin niya in terms of non-pharmaceutical intervention. Ang problema po sa DOH, hindi na siya innovative. Habang lockdown na lang po siya. Hindi niya dinidiscuss what happens if there is a vaccination and there is the coverage is low. What happens if the efficacy is not the same? Katulad ngayon, 95%, hindi pala 95, 60%. What happens ngayon sa reproductive number? No? So hindi niya yun dinidiscuss. And ang pinaka-importanting hindi nila dinidiscuss in terms of intervention, ano ang mangyayari kung may early treatment ka sa bahay? Hindi lang vitamin C, vitamin D, isolation. Ano ang mangyayari if you give something which is directly affecting viral replication? Wala ho silang sinasabing ganon. May tanong ho si Congressman Kim po, how will you depend on R0 which is changing? It will really change because through time, you should know that the virus mutates. And that there are already intervention in terms of vaccination. So you get averages. And you probably have a mathematical model, stochastic ba siya, or sensitivity analysis to determine the effect of this variable. And that is what you call sensitivity analysis. So hindi po tayo makakawala sa R0 kasi sinasabi ng literature, if your R0 is more than 1, your non-pharmaceutical intervention is as important as your pharmaceutical intervention. So dalawa po yung epidemiologic parameters, R0 and the serial interval.
Ma'am, can you wrap up already? Can you wrap up?
Oh, ito yung model na ginagamit nila, sir. Ito talaga vetted na to. Hinanap ko sila, if they have a publication, wala po silang publication. Meron lang yung isa sa UP Los Baños, it's preprint by Torres, and they said that the best model for the Philippines using Philippine data is ARIMA. No, not anymore SIR, kasi yung recovery mo is not fully recovered because they become infected again. So ito din ang isa, sir, pinakita ko sa inyo, sinasabi ni Congressman Herrera, where is the, tama po siya. Kailangan tingnan na natin dito, not the cumulative cases because it is counterintuitive. Tinitingnan ko po dito yung active cases at yung mga recoveries. Napakaliit po ng recoveries. Ang active cases hindi bumababa. Ano ibig sabihin nun? Nasa ospital sila. Nandun sila 3 linggo, 4 na linggo, eventually baka mamatay po. So, is mathematical model needed? Yes, it is needed because it also drives what intervention and you can monitor, but the data has to be accurate, valid, and it is supposed to be validated. So, ito ho yung cumulative na sinasabi ko ho sa inyo na dito ho sa baba are the cases. No, halos wala kang ang death, hindi mo na makita kasi ang makikita mo talaga, ang importante are the COVID cases per day. So ito ho yung RNAT natin kaya sinasabing hindi tayo resilient kasi tayo pa rin are more than one, is more than one pa rin ang RNAT compared to the world RNAT which has gone down lower than 1. So Octa, very hard to vet because there's no publication. I have searched for it. The only publication locally, I have not read about FASTER. I have read about Monica Torres, that's preprint. And the U6 model, dinet nila, they analyzed the 6 model and they found out that you can have different models in different regions because of our mobility. Hindi ho pwede mag-SIR ka for NCR applicable sa buong Pilipinas. Meron ng SEIR, meron ng Poisson, and that can be different across region. So are they currently using the right model? Stop looking at cases. Look at recoveries because that's the one using your hospital. Are they helping solve a problem or merely acting as purveyor of bad news? Are they transparent? Are the recommendations they give supported by validated data? I'm sure not because you have to clean it because I can see many errors like for example, death 0 ang DOH data. Ang recovery niya, ang active case niya, at recovery niya, minus 90 pa nga ang recovery. So medyo marami hong data problem. But that's not the fault of DOH. It's the fault of the researcher because you have to clean your data. Should you use mathematical modeling or just common epidemiologic sense? I think we should use more common epidemiologic sense. And perhaps Octa is satisfying the need of the public for honest information. Thank you.
Thank you, Dr. Dalmacion. I'll give Dr. Nicanor Austriatico 5 minutes, sir. Father.
So good afternoon, good morning from the United States. So I just wanted to add some comments to Congresswoman Stella Kimpo's point, 2 points. First, with regards to the pandemic, one of the challenges, of course, with peer review is that peer review takes a long time. I'm a peer reviewer myself. So one of the things that has been referred to by several of the other speakers is preprints. And one of the things that we hope to do with our manuscript is to upload it to medRxiv in order to make it accessible in preprint prior to its publication. And I mean, this is what I've been doing for my other papers over the past 18 months. And we hope to do that same thing imminently. The second thing is the comment of the Congresswoman Stella regarding the way that the United States deals with modeling. So I'm familiar with that. I'm actually doing modeling for my university here, where we are trying to model spread of the pandemic here in Rhode Island. One of the things that's really important to highlight is that there are numerous independent groups in the United States that present models online and to all news reports. So I just wanted to make a reference to that. So one of the most famous here in the United States is the Institute of Medicine. Let me see. It's the Institute of Health, Medicine, and Economics, I believe. And they have a projection online and they report to the, they are constantly being interviewed by the Associated Press. So here in the United States, we have numerous voices speaking alongside our national government. And actually, more importantly, because our pandemic management is done at the level of the states, each individual states has local universities that speak alongside the local Department of Health. So it's deeply decentralized in the United States with regards to the number of voices that are able to speak on the pandemic. And it's striking to me, and I'm still learning how the Philippines does it with regards to, clearly there are many voices here, and somehow we're still able to manage with the enormous amount of misinformation and numerous voices that often conflict. And I can see the challenge of that, but I'm trying to understand how the Philippines will respond to that challenge in a way that, as people pointed out, respects the balance of powers in the different government branches of government, as well as the independence of researchers. And I'm grateful that this Blue Ribbon Committee is responding to an enormous challenge that's not only in the Philippines, but throughout the world. So I'm done. I would like to invite my colleague, Dr. Guido David, who was not allowed to present our model. I think it's really important at this point, towards the end of the hearing, that you get the chance to hear our perspective on the model. Since the model has been subject to numerous questions and criticisms, I think it will be important just to hear him present, because he is our primary modeler. I had done modeling, which has been published on COVID-19 in the Philippines, but one of the things that I had a SIR model based on MIT, a machine learning account from MIT, my alma mater, where I worked with MIT people to develop this. But one of the challenges that we faced in the Philippines is that the data of the DOH has shortcomings in the past 2 weeks. And so what this happens is it challenges our ability to make machine learning based models. So this is why I joined Octa. And I hope you give Dr. Guido David a chance to actually articulate and to explain why the simple SIR model is able to do a lot. It might not do everything, but it's able to do a lot. Thank you very much, Sir Chair.
Thank you, Father. Actually, it's not our job to give an opinion on modeling. What is the most adequate model and the appropriate model? That's not the job of the committee. And our job is anyway. I'll just give Dr. Guido 5 minutes to give a summary.
Thank you very much, Chair. So I'd like to share my screen, and this is just quick. I'll try to go over this as quickly as I could. And yes, we use the reproduction number as our primary indicator because it is an international standard. And the SIR model is actually standard as well. That's why it's a bit embarrassing to, it's not really publishable in its own right because it's a standard model. What we do with the data is what makes the difference. This is in our belief. So in the Department of Health data drop, there are 4 key dates used: report date, specimen, release date, specimen date, and onset date. Report date is the number that you hear every day. So if you hear 12,000 cases reported, that's the case by report date, but some of those cases will be backlogged. And the onset date is the validated data set. So what we noted is that the date of onset is only 38% complete. And that's why we use report date. The key points here are that we use date of onset because, or we don't use date of onset because it's only 38% complete. There are also encoding errors that we noticed, and it's also highly correlated with date of reporting, which is what we use, 2 to 3 days. Okay, so further key points, the data error that we look at is only 5%. This means that this is the difference between date of onset and date of reporting when it's available. The error in projection varies because these are just projections. They're not meant to be correct or accurate. However, predicting an upward or downward trend is important for planning and policy making. And our models have 100% surge detection accuracy, meaning we have detected all the surges using the model. Going further, this is one of the projections that we made last February, and you can see that it was actually following the blue curve was the projection, and the green bars were the actual cases, and it was following that. It accelerated at some point, so it increased further than that. This was a projection we made last August 23 at the Go Negosyo Forum with PA Joey Concepcion. And you can see that there were two projections made, the silver and the green lines. And we actually projected and foresaw the decrease in cases that happened. So you can see that the actuals, the blue curve, was sort of in between these two projections. And this, again, documented, it was presented in Go Negosyo. And then a few things. This is actually what we said in statement. Cases may spike past 25K, but we won't reach 30K. It's just by Octa. On the other hand, I just want to clarify the confusion. There was a projection that we may reach up to 40K, but this was not made by Octa. This was actually a different team. So yun lang naman, Mr. Chair, thank you again for the opportunity to allow us to present. And
thank you, Dr. Guido. As there are no other members listed to interpellate, we are now closing the period of interpellation. The committee heard the positions, contentions of our members as well as response of our resource persons. We have substantial and relevant materials and documents that will be considered in the preparation of the draft committee report. To our resource persons and other parties affected by these hearings, you may submit your respective position paper and support documents on the subject of inquiry. For some who have not submitted their position paper, it is the position of the chair that their inaction will not otherwise affect the testimonies and documents already submitted to the committee and the information already gathered. I will stand as part of the records of the committee. Is there Hello?
Mr. Chair,
as there are no other members listed, is there any motion?
Motion to terminate the hearing, Mr. Chair.
Under the premises, is there any second?
Second.
Thank you. With the motion of DS Tin Mihan, duly seconded and hearing no objection, subject to the submission of documents requested by the members, the hearing of House Resolution 2075 is terminated. The committee secretariat is directed to draft the committee report and present to the committee members for their perusal. I move. Is there any motion to adjourn?
Motion to adjourn, Mr. Chair.
Thank you.
Second.
Thank you. Thank you, ma'am. As there are no other matters, the meeting is now adjourned. Maraming salamat po sa pagdalo at pagpupulong na ito. Manatili po tayong ligtas at malusog sa ating mga tahanan at komunidad. Magandang hapon po. Salamat po.
Salamat, Chair. Salamat, Chair.
Thank you.
Salamat,
Chair.
Thank you, Ma'am Sharon.
Ma'am